Okay. Good afternoon, everyone. नमस्कार भाई, नमस्कार सब लोगों को नमस्कार. Of hemorrhage is known as durate hemorrhage. Sometime a question comes, durate hemorrhage is seen in brain. Durate hemorrhage is seen in brain. Now, sir, there is a injury which is known as concussion injury of brain. There is an injury of brain. It is concussion injury. What is concussion injury? Here you are temporary unconscious. Here you are temporary unconscious due to head injury. This temporary unconsciousness due to head injury is known as concussion injury. This is known as concussion injury. Concussion injury. And Dr. Saab, in concussion injury, the brain has edema. This is known as Berlin edema. The brain has edema. This is known as Berlin edema. The brain has edema. This is known as Berlin edema. Durate hemorrhage is a hemorrhage of brain and bones. Concussion injury is temporary unconsciousness due to head injury is known as concussion injury. Diffuse axonal injury. Diffuse axonal injury. So this injury is injury of white matter of the brain. And sir, here axons are broken. Here axons are broken and it forms a ball which is known as retraction ball. Here axons are broken and it forms a ball that is known as retraction ball. Retraction ball. This injury is diffuse axonal injury. Diffuse axonal injury, axons are broken. This question comes, retraction ball is seen in brain. In brain. Durate hemorrhage is a hemorrhage of midbrain and bones. Berlin edema is also a edema of brain. Railway spine. Sir, in railway accident, accident of railway, you have spinal injury. In railway accident, you have spinal injury. This is known as railway spine. It is a concussion of spinal cord. It is a concussion of spinal cord. You have spinal cord injury. It is known as railway spine. Railway spine is spinal cord injury. It is injury of spinal cord. It is a injury of spinal cord. This is known as railway spine. So डॉक्टर साहब ये सारे क्वेश्चन आते हैं. Now I'm coming to very important regional injury, intracranial hemorrhage. Intracranial hemorrhage. What are the which are possible? These are known as intracranial hemorrhage. Sir, these are three meninges: dura, arachnoid, pia. This is epidural. This is subdural. This is subarachnoid, and this is cerebrum. So I can classify this. First is EDH. EDH is extradural or epidural hemorrhage. Extradural and epidural hemorrhage. Then comes subdural SDH. Then comes subarachnoid. And then comes it is intracerebral. Friends, these are hemorrhage. Extradural or epidural EDH, then SDH, SAH, then it is ICH. These are, yes, these are examples of different intracranial hemorrhage. Different intracranial hemorrhage. We have 4 types of intracranial hemorrhage. Now, what are the questions you generally get? Sir, first is epidural hemorrhage. Sir, epidural hemorrhage is always due to trauma, no other cause. Always due to trauma, no other cause. In epidural hemorrhage, we have lucid interval. And in epidural hemorrhage, the heat hematoma is epidural in nature. So first lucid interval we discussed in forensic psychiatry. But sir, this lucid interval is different. What is lucid interval of epidural hemorrhage? The person is unconscious, then become conscious, then again become unconscious. This interval is lucid interval. Unconscious, conscious, then again become unconscious. This phase of consciousness between 2 phases of unconsciousness, this is lucid interval. This is the first one. Yes, this is the first one, epidural hemorrhage. So again, you can get a question. It is always by trauma. It's not very common. Lucid interval, heat hematoma. Heat hematoma, as I told you, in heat we have hematoma. That is known as heat hematoma. Now I'm coming to SDH, subdural hematoma. SDH is subdural hematoma. Subdural hematoma. It is common in children and in old person. It is common in children and old person. It is common in alcoholic. It is common in alcoholic, and it is common as boxing injury. Sir, in boxing injury, this subdural hematoma is very common. And Dr. Saab, this question comes in exam. It can cause a very important syndrome. This is known as punch drunk syndrome. Punch drunk syndrome. What is the meaning of punch drunk? After punch, you behave like a drunk. That is known as punch drunk syndrome. This is because of subdural hematoma. This punch drunk syndrome is also known as dementia pugilistica. This punch drunk syndrome is also known as dementia pugilistica. It is common in children and old person. It is common in children and old person. Second, alcoholic. Third, in boxing injury. This is subdural hematoma. In boxing injury, there is a punch drunk syndrome. After punch, you behave like a drunk. This is known as punch drunk syndrome. Now come to SAH, subarachnoid hemorrhage. It is most common traumatic hemorrhage. It is most common traumatic hemorrhage. This is subarachnoid hemorrhage. Subarachnoid hemorrhage. Dr. Saab, thunderclap headache. Thunderclap headache is a very important first finding of subarachnoid hemorrhage. Thunderclap headache. Very important first finding of subarachnoid hemorrhage. Now I am coming to ICH, intracerebral hemorrhage. Intracerebral hemorrhage, sir, it is most common non-traumatic hemorrhage. It is most common non-traumatic hemorrhage. And Dr. Saab, most common site is internal capsule. You can remember intracerebral IC. And this is a very simple trick. Most common site is also IC, that is internal capsule. That is internal capsule. Most common site is internal capsule. So, sir, start revision, some important thing. Okay, I will revise. Start revision. Write down which hemorrhage is exclusively due to trauma only. Which hemorrhage is brain hemorrhage is exclusively due to trauma only. Yes, it is epidural. Absolutely right, my dear friend. It is epidural. It is always exclusively due to trauma. Alcoholic and boxing injuries are having common hemorrhage. What is the name of that hemorrhage? Subdural. Which is most common non-traumatic hemorrhage? Most common non-traumatic hemorrhage. ICH. Most common traumatic hemorrhage. Most common traumatic hemorrhage. SAH. Thunderclap headache is a symptom of. Thunderclap headache is symptom of SAH. Very good. Heat hematoma is a kind of which hemorrhage? Heat hematoma. Heat hematoma is kind of which hemorrhage? SAH. SAH. Very good. Sorry. Heat hematoma is EDS. Hematoma is EDS. Sorry. Lucid interval is seen in which hematoma? Yes, it is EDH. Durate hemorrhage is a hemorrhage of which organ? Durate hemorrhage is a hemorrhage of which organ? कौन से organ में hemorrhage होता है durate hemorrhage? Yes. It is midbrain and pons. Diffuse axonal injury is an injury of option A white matter, option B gray matter. White matter. Berlin edema is seen in which organ? कौन से organ में Berlin edema होता है? Which organ? Yes, it is brain. Brain edema is Berlin edema. It's a concussion of brain. Temporary unconsciousness is seen. Temporary unconsciousness is seen. Okay. So these are some very, very important hemorrhages. Very, very important hemorrhage. सर वैसे मैंने आपको मोस्ट कॉमन ट्रॉमेटिक हेमरेज बताया SAH, but you can confirm this in surgery because in forensic it is given in SAH, but probably in surgery you just confirm when you get surgery class. Most common traumatic hemorrhage given in surgery, that is SDH, is more commonly given in SAH, but this has to be confirmed in surgery only. Don't confirm this in forensic medicine because forensic has no issue with this. Confirm with surgery. This is just a suggestion for you because according to me in surgery SDH is more given. So if In surgery, HDH is more given, then you have to follow surgery, HDH. Otherwise, you can follow forensic medicine, because in forensic book, SH is given more commonly by trauma. Okay. So this is a confusion. That's why I told you. Now, sir, injuries in a person sitting inside a vehicle. Sitting inside a vehicle and person gets accident. See, this person is sitting inside a vehicle. This is a glass in front. This is steering. Okay. What are the possible injury? Sir, this face, yes. First injury, this face strike the glass. This is known as windshield injury. And observe, this is known as sparrow feet mark. Sparrow feet mark. Sparrow feet mark. Windshield injury, it causes sparrow feet mark. Now, sir, we have seat belt. Most common site of seat belt injury is mesentery. Most common site of seat belt injury is mesentery. Mesentery. And observe, there is fracture of lumbar vertebra in seat belt injury. Seat belt injury, there is a fracture of lumbar vertebra. This is known as chance fracture or seat belt fracture. Chance fracture or seat belt fracture, lumbar vertebra fracture. This tearing produces aortic tear. This tearing produces aortic tear. Aortic tear. The neck goes in hyperextension. Neck goes in hyperextension, and there is an injury of spinal cord. There is an injury of spinal cord. So this is known as whiplash injury. This is known as whiplash injury. Neck goes in hyperextension like this. We have an injury of spinal cord. This is known as whiplash injury. As I told you, whiplash injury is an injury of spinal cord. Sparrow feet mark are seen on the face. Seatbelt injury is most commonly of mesentery. And steering leads aortic tear. Steering leads aortic tear. Apart from this, dashboard. So dashboard which is present in car or in any vehicle, it causes patella fracture. It causes patella fracture. It causes patella fracture. Airbag, sir, airbag are protective to you, but sir, these can cause injuries of eye. These can cause injuries of eye. Yes. But sir, car, like you are sitting in a vehicle, if car goes in back part of the truck. Look, so actually what happens, car is small in size. What happens? The car goes in back part of the truck. This phenomena causes injury to head and shoulder of car occupant. This causes injury to head and shoulder of car occupant. And observe, this phenomena is known as tailgating. This phenomena is known as tailgating. Tailgating. Anyways, thoda sa revise kar lo. What is the most common site of sparrow feet mark? Most common site of sparrow feet mark? Yes, let me see your answer. Sparrow feet mark, face. Aortic tear is seen due to injury due to aortic tear. आपके व्हीकल के कौन से पार्ट के कारण होता है? स्टीयरिंग. मोस्ट कॉमन साइट ऑफ सीट बेल्ट इंजरी, मिसेंट्री. Whiplash injury of the spinal cord is hyperextension of the neck or hyperflexion of the neck? Hyperextension of the neck. Patella fracture is due to which part of the car or which part of the vehicle? Patella fracture. Yes, it is dashboard injury. Dashboard जो आपके आगे होता है. What is the most common site of airbag injury? Everyone knows अगर airbag खुलेंगे तो आपके सबसे ज्यादा बछड़ा कहाँ लगेगा? You will get damage to the eyes. Airbag injuries. Tailgating का मतलब है the vehicle goes just behind the car and this phenomena is known as tailgating. This phenomena is known as tailgating. So, Doctor, you can get a question. What is tailgating? Tailgating is a phenomena where you can get inside the or behind the truck or car. Now, sir, these are possible injury. Now, I am going to discuss pedestrian injury. Sir, you are a pedestrian. This is a vehicle. Now we can see what are the example of pedestrian injury. See. First impact, this is first impact of the vehicle. This is second impact of the vehicle. Now, Doctor, first I'll discuss first impact. Yes. Vehicle striking pedestrian. Pedestrian का मतलब जो पैदल चलता है. Doctor, this is known as primary impact injury. This is known as primary impact injury. And sir, primary impact injury is on the leg. Primary impact injury is on the leg. Yes. And Doctor, we have a fracture which is known as bumper fracture. Bumper fracture is a fracture of tibia. Bumper fracture is fracture of tibia. This is known as primary impact injury. Now, sir, you have two future. Either you will roll over the vehicle or you will be rolled over by a vehicle. So if you are rolling over the vehicle, there will be multiple injury on the body. And if you are rolled over by vehicle, there will be tire mark on the body. Doctor, this is known as secondary impact injury. This is known as secondary impact injury. So sometime you get a question, tire mark are example of secondary impact injury. Bumper fracture is example of primary impact injury. So these are primary impact and second impact. Now, sir, you will be thrown away. This one. Now, sir, the person will be thrown away. When person is thrown away, person will strike the ground or any other object. He'll strike the ground or any other object. Sir, this injury is most dangerous injury. This is known as tertiary impact injury. And sir, tertiary impact injuries are also known as secondary injuries. Tertiary impact injuries are also known as secondary injury. Why tertiary impact injuries are known as secondary injury? Sir, these are different. Primary impact is different. Secondary impact is different. Tertiary impact are known as secondary injury because these are not by vehicle. These are not by vehicle. Anyway, sir, these are the type of injury we have. These are type of injury we have. Now I'll ask some question. Bumper fracture is seen in which injury? Bumper fracture of tibia is seen in which injury? Which injury? Bumper fracture of tibia. पूरा लिखो, प्राइमरी मत लिखो गोलगप्पों. नॉट प्राइमरी. ये प्राइमरी थोड़ी है. पूरा लिखो. क्या नाम है पूरा? It is not primary, friend. No, it's a primary impact injury. Very good. Yes. Tire mark are example of which injury? Yes, it is secondary impact injury. Okay. Most dangerous injuries are primary impact or secondary impact or tertiary impact. It is tertiary impact injuries are most dangerous injuries. Tertiary impact injuries are also known as yes, secondary injuries. Yes, Damodaran, absolutely right, my dear friend. Yes, absolutely right. बहुत बढ़िया. Now, sir, I am coming to in the same manner blast injury. Blast injury, same manner, primary blast injury, secondary blast injury, tertiary blast injury, and quaternary blast injury. Primary, secondary, tertiary, quaternary. Sir, primary blast injury, the mechanism is air compression. Primary blast injury, the mechanism is air compression. The surrounding air is compressed after blast. So, Dr. Sahab, those organs which are in contact with air, sir, first organ which are those organs which are in contact with air, the first is tympanic membrane to be damaged. Second is lung. So these are two organs to be damaged. So the first organ to be damaged is tympanic membrane. Second is lung. So this is because of air compression leading primary blast injury. This is primary blast injury. Now, what is secondary blast? Secondary blast, all surrounding object will hit your body. Surrounding object will hit your body. So, hitting of the body, there will be pattern abrasion, pattern contusion, and pattern laceration. Doctor Sahab, this triad is known as Marshall's triad. So objects surrounding you hitting your body, there will be pattern abrasion, pattern contusion, and pattern laceration. This will produce a triad. This is known as Marshall's triad. This is known as Marshall's triad. Now come to, sir, another important injury, that is tertiary blast. Object hitting you, this is secondary blast. Now you will be thrown away. You will be thrown away. This, then you will hit the ground. This is tertiary blast injury. Tertiary blast injury. And what is quaternary blast? Injury produced by burn and flame. Injury produced by burn and flame. This is known as quaternary blast injury. This is known as quaternary blast injury. Quaternary blast injury. Now, Dr. Saab, so you can get a question. Air compression surrounding air leads, तो ऐसे ही आपसे सवाल पूछता हूं, air compression leads which injury, my dear friends, of the organ? Which injury? Primary blast or secondary blast? Primary blast. Marshall's triad, because of object hitting you, is seen in which injury? Object hitting you. Secondary blast. You are in air and then you hit the ground. Which injury is this? Tertiary blast. And Dr. Saab, flame and burn causing injury in your body. What is the name of that injury? Anyone? What is the name of that injury? Yes, it is quaternary blast. It is quaternary blast. Very good. So these are the types of injury. Now, sir, most common organ injured in blunt trauma is spleen. Most common organ injured in penetrating, I told you penetrating, word in stab injury when it goes in cavity, it is liver. Liver, most common organ in penetrating trauma. Blunt trauma is spleen. Most common organ in underwater blast. The answer is intestine. Normally it is lung, but underwater blast. So, sir, these are some common questions. Spleen is the most common organ. Yes, in blunt trauma. Liver is the most common organ in penetrating trauma. Yes. And then most common organ in underwater blast. The answer is yes, no doubt. This is intestine. The answer is intestine. These are some questions which can be asked in examination. Okay, anyways, sir, these are some very, very important MCQ which we discussed here. Now I am coming to the last very important injury, my dear friend, ballistic. Ballistic. ब्लास्ट होगा तो इनमें से कोई भी इंजरी हो सकती है. हाँ, कोई भी इंजरी हो सकती है. प्राइमरी ब्लास्ट भी हो सकती है, सेकेंडरी ब्लास्ट भी हो सकती है. डिपेंड करता है कितना बड़ा ब्लास्ट था. प्राइमरी ब्लास्ट का मैकेनिज्म एयर कंप्रेशन है. सेकेंडरी ब्लास्ट में आपके आसपास के ऑब्जेक्ट हिट करते हैं. टर्शियरी ब्लास्ट में आप उड़ के जाते हो, और क्वार्टरनरी ब्लास्ट में आपको आप जलते हो. जलने से इंजरी होती है. बैलिस्टिक, study of firearm. Study of firearm. This branch is known as ballistic. And Dr. Saab, you can get a question. Father of ballistic is Calvin Goddard. Father of ballistic is Calvin Goddard. लंग भी होगा, लंग भी होगा, बट अगर आप पूरा इमर्स हो तो लंग नहीं होगा. इफ यू आर फुली इमर्स देन लंग विल नॉट बी देयर. Lung is injured when air is in contact. Okay, so that is the reason. दोनों में lung हो सकता है, but most common is intestine if it is fully inside the water. Father of ballistic is Calvin Goddard. Sir, see, if this is a weapon, this is a trigger, this is muzzle end, this is barrel. This is barrel, trigger, muzzle end. Now, sir, see, if the bullet, yes, traversing inside the barrel, if bullet traversing inside the barrel, this branch is known as internal ballistic. Bullet traversing outside the barrel, this branch is known as external ballistic. And effect on the target, T for target, it is known as terminal ballistic. So internal ballistic, external ballistic, and terminal ballistic. On the basis of cross section of barrel, on the basis of cross section of barrel, we can classify weapon in two types: rifled firearm and smoothbore firearm. On the basis of cross section of weapon, we can classify weapon in two categories. We can classify weapon in two categories. One is rifled firearm. Another is another is smoothbore firearm. One is rifled firearm, another is smoothbore firearm. Rifled firearm and smoothbore firearm. Two type of weapon we have. On the basis of cross section, we can classify weapon into category. Now, sir, when you see rifled firearm inner side, you will see elevation and depression like this. These elevations are known as land. These elevations are known as land, and depression are known as groove. Elevations are known as land, and depressions are known as groove. In smoothbore, the complete surface is smooth. Now, sir, here bullet fires, here pellet fires, pellets. Bullet comes one by one, pellet comes multiple. Bullet comes one by one, pellet comes multiple. So this question also comes in exam. The distance between two opposite length. The distance between two opposite length, this distance is known as caliber. The distance between two opposite length, the distance between two opposite length, this distance is known as caliber. Bullet and pellet both are composed of lead. Bullet and pellet both are composed of lead. But bullet comes one by one and pellets come multiple. Friends, bullet are coming one by one. Bullet has rotation. So because bullet is coming from the land and groove, rotation is present here, rotation is absent. Now, sir, because of rotation, there is increased gyroscopic moment. Gyroscopic moment is increased. There is no change in the gyroscopic moment. And sir, when there is an increase in the rotation and gyroscopic moment, the velocity is high. Here velocity is low. That's why range is good in rifled firearm. Here range is less. Actually, it's very simple. Bullet is coming through land and groove. Land and groove are irregularities. Land and grooves are irregularities. If bullet is coming through the irregularity, bullet gets rotation. If it is rotated, there is increased gyroscopic moment, increased velocity, increased range. So one thing is clear, rifled firearm has good range and smoothbore weapon has less range. So this is a very simple difference. Here bullet is fired, here pellets are fired, rotation present, rotation absent, gyroscopic movement, velocity and range increase. Here no gyroscopic movement, velocity is less, range is less. Now what are the examples of? Rifled firearm and smoothbore firearm? See, you can see revolver, range is 200 yards. Revolver, range is 200 yards. Pistol, range is 400 yards. Range is 400 yards. Rifle, range is 1000 to 3000 yards. These are the example of, yes. But sir, if you see the example of smoothbore weapon, if you see these are the example of rifled firearm. If you see the example of smoothbore weapon, yes, the example is shotgun. Yes, the example is shotgun. Range is almost 50 yards only. It means, sir, the shotgun has very small range. Revolver, again I'm revising, my dear friend. Revolver range is 200 yards. Pistol range is 400 yards. Rifle range is the highest range, 1000 to 3000 yards. Shotgun range is just 50 yards. 50 yards. 50 yards. Now, sir, it means smoothbore weapon like shotgun has very short range. How to increase the range? How to increase the range of shotgun? We have two mechanisms. First, see, this is barrel of shotgun. This is barrel of shotgun. First mechanism, the terminal end of the shotgun, this is shotgun, terminal end of the shotgun is constricted. Terminal end of shotgun is constricted, so the pellets are going in a single direction. This phenomena is known as choking. So this is the first thing by which we can increase the range of shotgun. First is choking, terminal end is constricted. Second, what we can do, terminal end has been provided with rifling, that is land and groove. Terminal end has been provided with rifling. राम राम सर. भंवर जी शाम का बात करनी पड़ी, क्लास चल रही है. ठीक है सर. Terminal end has land and groove. This phenomena is known as rifling. This phenomena is known as rifling. And Dr. Saab, this gun is known as paradox gun. Dr. Saab, these are two mechanisms. What are two mechanisms by which we can increase the range? First is choking. Second is paradox gun. What is the meaning of choking? Terminal end is constricted. This phenomena is known as choking. And what is paradox gun? Terminal end is rifled. Rifled means land and groove are provided there. This phenomenon. Dr. Saab, by these two mechanisms, we can increase the range of, shotgun. Shotgun. Now, sir, tell me anything. Like I will ask you a few questions. What is the range of revolver? Anyone? What is the range of revolver? How many yards?
200.
Bolo yaar, bolo mat likho. What is the range of pistol? 400 yards. What is the range of rifle? Rifle 1000 to 3000 yards. What are the two mechanisms by which we can increase the range of shotgun? We can increase the range of shotgun. What are the two mechanisms? First, choking. Second is paradoxing. Rifling. That is a paradox gun. Paradox gun. Caliber is a word used for rifled firearm or smoothbore firearm. Caliber. Caliber. Rifled firearm. Caliber is a distance between two opposite. Caliber is a distance between two opposite. What is the answer? Two opposite. Yes, this table is continue. Okay. Two opposite length. Okay, done. Now, sir, for smoothbore weapon, we use word bore. What is the meaning of bore? What is the meaning of bore? Sir, like I'm giving example, 12 bore and 24 bore. What is the meaning of 12 bore shotgun and 24 bore shotgun? Sir, this is a lead sphere. This is a lead sphere of 454 gram. This is a lead sphere of 454 gram. Both are lead sphere of 454 gram. Okay. I divided this in 12 part, and I divided this in 24 part. Doctor sir, here size of one part will be 1 by 12, and here size of one part will be 1 by 24. And Doctor sir, this size is pellet size. This size is pellet size. It means, sir, what is the meaning of 12 bore gun? a 454-gram lead sphere is divided in 12 parts. It is a 12 organ, and 24 organ, a 454-gram lead sphere is divided in 24 parts. Roxal, here one pellet size will be 1 by 12. Here one pellet size will be 1 by 24. So now tell me, pellet size will be more in. Pellet size will be more in anyone, 12 organ or 24 organ. Pellet size will be more in 12 organ or 24 organ. Let me know. Yes, the answer will be 12 organ. It means, sir, what is the meaning of this? Yes, it is absolutely. If bore, yes, AK-47 is a rifle, yaar. कितना दिमाग लगाते हो तुम भी? It is, yes. If bore is more, size of pellet would be less. If bore is more, size of pellet would be less. That is a very, very important part. Okay. Now this table should be continued. No issue. Now, sir, these bullet and pellet are present in cartridge. This is a cartridge of rifle firearm. This is a cartridge of smoothbore firearm. Sir, in rifle firearm cartridge, we will have a single bullet. Yes, this is a single bullet. And smoothbore firearm cartridge, we will have multiple. This is bullet. We will have multiple pellets. These are multiple pellets. Sir, in smoothbore and rifle firearm cartridge, we have a powder. Yes, this is a powder. This powder is known as gunpowder. I will discuss gunpowder. But sir, in smoothbore firearm cartridge, we have one thing. This is known as felt wad. Felt wad is only present in smoothbore 1 cartridge. That is a lubricant. Felt wad is a lubricant. In the base of cartridge, we have primer. Primer is the first thing which burns. That is a primer. But sir, anyways, main thing is a gunpowder. Because why main thing is a gunpowder? When gunpowder burns, GP is gunpowder. When gunpowder burns, smoke produces, and smoke, because of smoke, pressure increases in cartridge. So when pressure increases, bullet will be fired and pellets will be fired. That's a very simple mechanism. When gunpowder burns, smoke produces, धुआं निकलता है, and because of smoke, pressure increases. And Dr. increase in pressure here, increase in pressure here, this bullet and pellets fired. Bullet and pellets fired. This is the mechanism. This is the mechanism. First primer burns, then gunpowder burns. First primer burns, then gunpowder burns. Anyways, sir, felt wad is only present. Felt wad is only present in shotgun cartridge, not in rifle firearm. Felt wad. Now, sir, write down gunpowder. Gunpowder. First, I will discuss types of gunpowder. First is a black gunpowder. Types of gunpowder. First is a black gunpowder. What is black gunpowder? Black gunpowder is potassium nitrate, 75%. Potassium nitrate, 75%. Charcoal, 15%. And sulfur, 10%. This is the composition of black gunpowder. Again, I'm revising, my dear friend. Potassium nitrate, 75%. charcoal 15%, yes, and sulfur 10%. This is a composition of black gunpowder. Second gunpowder is a smokeless gunpowder. Second gunpowder is a smokeless gunpowder. It has three types: single base, double base, and triple base. Single base, double base, and triple base. Single base contain nitrocellulose. Double base contain nitrocellulose plus nitroglycerin, and triple base contain nitrocellulose plus nitroglycerin plus nitroguanidine. These are example of, again I'm revising my dear friend, black gunpowder contain potassium nitrate, charcoal, sulfur. Black gunpowder contain potassium nitrate, charcoal, sulfur. Smokeless gunpowder, single base contain nitrocellulose, डबल बेस कंटेन नाइट्रोसेल्यूलोज प्लस, सिंगल बेस में सिंगल होगा नाइट्रोसेल्यूलोज, डबल बेस हैज नाइट्रोसेल्यूलोज प्लस नाइट्रोग्लिसरीन, ट्रिपल बेस कंटेन nitrocellulose, nitroglycerin, and nitroguanidine. These are the examples of gunpowder. Gunpowder. Two type of gunpowder. Now, sir, on gunpowder, what is mentioned? FG, double FG, triple FG. Dr. Saab, more F, finer gunpowder. More F, finer gunpowder means thin gunpowder. So the number of F are more, yes. Number of F are more, gunpowder will be more fine. Yes, absolutely right. The number of F are more F, finer gunpowder. More F, finer gunpowder. Thin gunpowder will be there. That is the meaning of F. What are the tests for detection of gunpowder? You can remember by hands. H for Harrison test. H for Harrison test. A for atomic absorption. A for atomic absorption spectroscopy. Atomic absorption spectroscopy. N for neutron activation analysis. Neutron activation analysis. D for dermal nitrate test, which is also known as paraffin test. And S for scanning electron microscope. Scanning electron microscope technique. This is known as SEMDEXA. Scanning electron microscope. This technique is known as SEMDEXA. Anyways, sir, this test is not used nowadays. Again, I'm revising, my dear friend. What are the tests for detection of gunpowder? Revising this, Harrison test, number one. Number one test is Harrison test. Number two is atomic absorption spectroscopy. In short, it is known as AS. Neutron activation analysis, it is known as NA. Dermal nitrate test, which is known as paraffin test, and scanning electron microscope, SEMDEXA test. These are the tests for, this is considered as a best test. Anyways, Write down. These are the tests for detection of bullet or gunpowder. These are the tests for detection of bullet or gunpowder. Bullet or gunpowder. Gunpowder. More F denotes gunpowder is more, thicker or thinner. Finer. That is thinner. Thinner. Which test is not used for nowadays for gunpowder detection? Which test is not used? Yes, paraffin and dermal nitrate test. Paraffin or dermal nitrate test. Paraffin and dermal nitrate test. Felt wad is present in the cartridge of rifled firearm or shotgun. Rifled firearm or shotgun. Wad. Wad is present in rifled firearm or shotgun. Shotgun. It's not present in rifled firearm cartridge. Okay, shotgun. Okay. So again, these are some very important point, my dear friend. What is the composition of black gunpowder? What is the composition of black gunpowder? Anyone? Black gunpowder? Potassium nitrate? Yes. Charcoal? Yes. Sulfur. Potassium nitrate, charcoal, and sulfur. Okay, very good. Now, sir, write down. We have discussed the gunpowder. Write down types of bullet. Types of bullet. Sir, first is dum-dum bullet. I will show you the picture of dum-dum bullet. Sir, what is dum-dum bullet? The terminal end of bullet, like this. This terminal end of bullet is chiseled out. Terminal end of bullet is chiseled out. So whenever it strikes the object, it will cause explosion. Dum-dum bullet, the terminal end of the bullet is chiseled out. And observe, this question also comes in exam. It is maximum damaging bullet. It is maximum damaging bullet. Dum-dum bullet. First bullet. Second bullet, express bullet. Sir, express bullet, the base of bullet, express bullet, the base of bullet contain hole. That's why it has high velocity. High velocity bullet is a express bullet. The base of the bullet contain hole. High velocity bullet, express bullet. Tracer bullet. Sir, as the name suggests, tracer bullet, wherever it goes, it liberates powder. So we are able to trace it. It liberates powder. We are able to trace it. This is a tracer bullet. Incendiary bullet. Sir, incendiary bullet contain phosphorus. Express bullet contain hole in the base. तो इसके नीचे होल होता है, इसलिए हाईएस्ट वेलोसिटी होती है. Tracer bullet, we can trace it because it liberates powder. Incendiary bullet contain phosphorus. Sir, frangible bullet. F for frangible. F for it divides in fragments. F for frangible bullet. F for it divides in fragments. So fragmented bullet is a frangible bullet. Sir, glancing bullet. G for glancing bullet. G for it causes gutter fracture. That's a very simple trick. So what is this bullet? Touch and go. Just touch and goes. That is known as GG. Glancing bullet. Glancing bullet. Number 7. Souvenir bullet. As for souvenir, which present in skin and subcutaneous tissue for long time. If bullet is present in skin and subcutaneous tissue for a long time, this is known as souvenir bullet. Souvenir bullet. Plastic or baton bullet. Plastic or baton bullet. It is composed of polyvinyl chloride, PP. It is composed of, so Dr. Sir, you can see FFGG SSPP, polyvinyl chloride. This is known as plastic bullet or baton bullet. Then ricochet bullet. Ricochet bullet, which strike the object, ricochet bullet, which strike the object and deflected. So this deflected bullet is known as ricochet bullet. Deflected bullet is a ricochet bullet. And Dr. It means, sir, the feature of the entry wound, because it is a deflected bullet, when it is deflected from some object, then it goes in your body. This deflected bullet is known as ricochet bullet. Number 10, yawning bullet. Slow and irregular bullet. Slow and irregular bullet like this. This is known as yawning bullet. Tumbling bullet, which tumbles on end. Any bullet which tumbles on end, like this is a bullet, it tumbles on one end, another end, this is known as tumbling bullet. Ricochet bullet strike the object and deflect it. Ricochet bullet is strike the object and deflected. Yawning bullet, slow and irregular bullet, and tumbling bullet, which tumbles on the end, this is known as tumbling bullet. This is known as tumbling bullet. And the last one is tandem bullet. Friends, tandem bullet is also known as piggyback bullet. Tandem bullet is also known as piggyback bullet. So, sir, what is tandem bullet? Sir, see, this is the first bullet. It is present here, and the second bullet pushes first bullet. Second bullet pushes first bullet. So both bullets coming simultaneously. Two bullets coming simultaneously out. This is known as tandem bullet. Tandem bullet. Two bullets coming simultaneously. Second bullet pushing one. That is a tandem bullet. Tandem bullet. And also, what is tandem cartridge? What is tandem cartridge? This is a cartridge. If two bullets are present in single cartridge, again answer is 2. If two bullets are present in single cartridge, this is known as tandem cartridge. Two bullets are present in a single cartridge, so there will be two entry wound. Definitely two bullets are present in single cartridge. This is a tandem cartridge. चलो मेरे साथ जवाब दो. पहले आपको कुछ पिक्चर दिखा देता हूं. I will show you some picture. Then you can see. पहले तो रिवाइज करो. Bullet deflected from the target is known as. bullet deflected from the target is known as? Anyone? Yes, it is a ricochet bullet. Yes, it is a ricochet bullet. Very good. It is a ricochet bullet. Bullet deflected from the target is known as ricochet bullet. Very good. Second, fragments dividing bullet. Fragments में divide होती है. This bullet is known as? Anyone? This is, yes, frangible bullets. Which bullet deposited in skin and subcutaneous tissue? Skin and subcutaneous tissue deposition bullet is known as? Souvenir bullet. Absolutely right. It is souvenir bullet. One bullet pushing another bullet. So two bullets coming out are example of which bullet? Two bullets coming out are example of which bullet? Yes, friends. It is tandem bullet. Absolutely right. Maximum damaging bullet is known as? Maximum damaging bullet is known as? Maximum damaging bullet. It is dum-dum bullet because the terminal end is chiseled out. Yes. Slow and irregular bullet is known as? Slow and irregular bullet is known as? Yes. It is yawning bullet. Which bullet contain phosphorus? Which bullet contain phosphorus? Incendiary bullet. Now, Dr. Sahib, you can see this picture. Can you see the picture? Yes, shotgun cartridge. Sir, what is the difference between shotgun cartridge? I told you this is a cartridge of shotgun. These are the pellets. Yes, I told you these are the pellets. These are the pellets. Can you see the picture? Can you see the picture? Yes, okay. This is shotgun cartridge. Okay, no issue. Sir, this is dum-dum bullet. Very, very important. The terminal end is chiseled out. This is known as dum-dum bullet. This will cause maximum damage. This will cause maximum damage. This is known as dum-dum bullet. This is known as dum-dum bullet. Sir, this is cartridge. This is a cartridge of shotgun. And this is a cartridge of rifled firearm. Yes, here you can see bullet. Here we have pellets. These are pellets. This is WAD I told you. This is gunpowder, GP. Whatever I told you, that is present here. Anyways, this is a very, very simple. So no issue. These are given in diagram only. These are cartridges. Okay. Now, sir, bullet. As I told you, bullet is composed of lead. Velocity of bullet is equally proportional to fatality of bullet. Velocity of bullet is equally proportional to fatality of bullet. Fatality of bullet. Prabhakaran, this topic comes in exam. This is a very important one. सर बहुत बोरिंग टॉपिक है, क्या करें? बोरिंग है तो पढ़ना तो पड़ेगा ना, एग्जाम में छोड़ नहीं सकते. नाउ सर, इफ बुलेट्स आर प्रेजेंट इन क्राइम सीन, if but Akshav, it's very important topic for forensic because when you conduct the postmortem, you have to examine the bullet because you take bullets out from the body. Bullets are present in the crime scene. Bullets are present in the crime scene, and this question comes: how do we pick bullet? How do we pick bullet? Dr. Saab, bullet has to be picked by hand. Don't use any instrument. After wearing gloves. This question comes in exam, my dear friend. Bullet has to be picked by hand after wearing gloves. Don't ever use any instrument. This question comes in exam. In crime scene, how do we pick the bullet? Why are we picking bullet by hand? Why not by any instrument? Because, sir, every bullet has two marking. One is primary marking. Another is secondary marking. Every bullet has two marking. One is primary marking, another is secondary marking. Bullet has to be picked by hand only. Every bullet has two marking, primary marking. Sir, primary marking decide class of a bullet, and secondary marking is individual marking. Now, sir, how to differentiate this? Sir, primary marking is decided by manufacturing specification. Manufacturing company. Manufacturing company. Yes. Dr. Saab, it means like Reliance company has formed 100 pistol, and these 100 pistol has, for these 100 pistol we have 10 lakh bullet. Sir, these all 10 lakh bullet will have same primary marking. These all 10 lakh bullet will have same primary marking. Why? Because, sir, these all 10 lakh bullet has same class. That is 100 pistol from same manufacturing company. Same manufacturing company. But, sir, see, when bullets fired, like this is a weapon barrel, when bullet is coming out from the weapon, now, sir, this individual gun, this form marking, this individual gun for every bullet that forms marking, this is secondary marking. This is secondary marking. And Dr. Saab, this secondary marking is also known as fingerprint of firearm. This secondary marking is also known as fingerprint of firearm, or it is also known as bullet fingerprint. This is known as secondary marking when bullet comes out. Dr. Saab, मेरे साथ रिवाइज करना. Listen carefully. Listen carefully. Very, very carefully. Dr. Saab, the manufacturing specification which is designed by a company decide the marking. What is the name of that marking, my dear friend? What is the name of that marking? What is the name of that marking? Primary or secondary? Primary. Okay, primary marking. But when bullet is coming out through the firearm, that individual firearm produces marking on the bullet. What is the name of that marking? Secondary marking. It is a very interesting topic, my dear friend. It's not a boring topic. According to me, it is the best and most interesting topic of forensic medicine. Isn't it? It is the most interesting topic of forensic medicine. It's not boring at all. I don't know, Prabhakaran, why did he say like it's a boring topic? It's never a boring topic. It is a secondary marking. Now, Dr. Saab, if you get a question, now I'm putting a question in front of you. Bullet fingerprint is an example of primary marking or secondary marking? Bullet fingerprint is an example of primary marking or secondary marking? Secondary marking. So, another question, okay? If you are picking, like, see, this is a bullet. This is a bullet. You pick this bullet by an instrument like forceps. You pick the bullet by instrument that is a forceps, and this forceps produces marking on the bullet. This is also a secondary marking. So, Dr. Saab, secondary marking is any marking which may be when the bullet is going through the weapon or maybe after coming out of the weapon. This marking is a secondary marking. Bullet fingerprint produced by the firearm is a secondary marking. Individual weapon producing marking on the weapon is secondary marking. If you pick a bullet by instrument, there is a marking. This is also a secondary mark. Very, very important. Dr. Saab, bullets should always be picked by hand because these produces, yes, these produces marking. Now, sir, how to differentiate entry wound from exit wound? Now, first see the size. Sir, entry wound is generally small in size. Exit wound is comparatively large, small, large. But sir, there is exception. There we have exception. That is contact shot. That is contact shot. Contact point blank. Sir, in point blank, entry wound is large and exit wound is small. That's the difference. Sir, why in contact shot it's large? Because it is a contact, there will be bursting of the skin. So in contact shot, you will see it is delayed shape, or it is also known as cruciate shape. It is star shape, stellate shape, or it is known as cruciate shape. Why it is large, sir? Because there is no gap between the weapon and there is a bursting of the skin. This is contact shot. So in contact shot, it is large, exception, and exit wound is small. Yes, large, small, small, large. Now, sir, margins. Margins is inverted like this. Inverted means like this. Inverted in exit. Inverted, inverted. Now, sir, another important word coming to margins are inverted, inverted. Tissue color. Sir, what is tissue color in entry wound? See, we have smoke. Smoke has carbon monoxide. Carbon monoxide combined with hemoglobin, it forms carboxyhemoglobin. Carboxyhemoglobin provides cherry red color. So tissue color in entry wound because smoke produces, this is because of smoke. But sir, there is no effect of smoke in exit wound, no color change. Cherry red color of tissue in entry wound, not in exit wound. Sir, abrasion color may be present in entry wound, absent in exit wound. Abrasion color may be present in entry wound, absent in exit wound. Sir, muzzle impression. Like this is muzzle end. Muzzle end, if this muzzle end forms an impression, that can be present. Yes, it is absent. Plus minus, plus minus. That can be present. That is absent. Muzzle impression. Muzzle impression, that can be present. Very, very important. Now, sir, if it is a shotgun, if it is a shotgun, entry wound has three type of shape. If it is a shotgun, entry wound has a three type of shape. This is ORS. What is ORS? Oval shape, rat hole shape, and satellite shape. Oval shape, rat hole shape, and satellite shape. Oval shape is seen when shotgun is less than 1 meter. Rat hole shape is seen when shotgun is 1 to 2 meter. And satellite shape is seen when the shotgun is more than 2 meter away. These shapes are not seen in exit wound. Again, I'm revising, my dear friend. Generally, size is in entry wound is small, exception is contact shot. Margin are inverted. Tissue is cherry red in entry wound. Abrasion color and muzzle impression can be present in entry wound. And in shotgun, the shape of entry wound we can remember by a very simple trick, ORS. ORS. Now, sir, entry wound has all. There is a phenomena which is known as SBT phenomena. Entry wound has a phenomena. This is known as SBT phenomena. What is SBT? SBT. What is SBT? As for singeing of hair, it is because of flame effect. Because flame touches the skin, produces singeing. Blackening surrounding the tissue. It is because of burnt gunpowder, GP's gunpowder. Tattooing is unburnt gunpowder which goes surrounding the entry wound skin. Sir, this phenomena is present, SBT phenomena present in entry wound, absent in exit wound. And Dr. Saab, this SBT decide range of weapon. This SBT decide range of weapon. SBT decides range of weapon. Singeing is because of flame touching the skin. There will be burning of the hair. What is the singeing of hair? Burning of hair is because of flame effect. Burnt gunpowder deposited surrounding the entry wound, blackening. Unburnt gunpowder, yes, unburnt gunpowder goes inside the skin, that is tattooing. So this is SBT decide range. But this is absent, this is absent, this is absent in exit. All are absent in exit. All are absent in exit. Now, see, I will show you some picture. Sometimes this picture comes in exam. Yes, we have seen this one. This is a dum-dum bullet. We have seen this one, which is a very important picture. We have seen all these pictures. Images very important. Sir, this is tattooing. Sir, this is tattooing is burnt gunpowder or unburnt gunpowder? It is unburnt gunpowder goes in the skin. This is known as tattooing. One phenomena, tattooing. Surrounding the, it is present surrounding the exit wound or entry wound? Yes, it is entry wound. Entry. Now you can see, this is entry wound. You can see. Now tell me, the margins of entry wound are everted or inverted? You can see in this one. You can see it is going inside. This is inverted margin. Sir, as I told you, star shape entry wound. Anyone? Star shape entry wound. It is contact shot. Star shape entry wound. And even you can see, sir, here it is going inside. Here it is going inside. It is inverted margin. Inverted margin. Inverted margin. Okay. So, Dr. Saab, again I am speaking. Just revise with me. It's a very important topic, my dear friends. मेरे साथ थोड़ा revise करना. Okay, let me explain again. अरे भाई रिलायंस वाला नहीं, मैं रिलायंस तो ऐसे ही बोला. कोई भी कंपनी बुलेट्स को बनाती है, जैसे मैंने 1000 बुलेट बनाई 10 वेपन के लिए, तो उन सब की क्लास सेम होगी. दिस इज प्राइमरी मार्किंग ऑफ द बुलेट विच इज डिसाइडेड बाय मैन्युफैक्चरिंग कंपनी, विच इज डिसाइडेड बाय.
सर आप टेबल के स्टार्टिंग
कौन सा? क्या
टेबल स्टार्टिंग?
टेबल
स्टार्टिंग.
ओके, एक मिनट. यस, यहां से. यस
सर एग्जिट वाउंड इज लार्ज और स्मॉल?
लार्ज है ना.
आपने स्मॉल लिख रखा है.
अरे करम जले, ये क्या है?
अच्छा उधर, ठीक है, समझ. ठीक है सर.
बट मैंने एक्सेप्शन क्या बोला? कॉन्टेक्ट शॉट. कॉन्टेक्ट शॉट में क्या है? एग्जिट वन स्मॉल.
ठीक है सर.
ओके, स्टिलेट, क्योंकि कॉन्टेक्ट शॉट में कौन सी शेप होता है? अभी तो पढ़ाया. ये देखिए, ये शेप. दिस इज द शेप कॉन्टेक्ट शॉट. ओके, मार्जिन्स इन्वर्टेड. टिश्यू कलर चेरी रेड इन एंट्री वुंड. एब्रेजन कलर, एब्रेजन कोलर. एब्रेजन कोलर होता है. प्रेजेंट हो सकती है. मसल इंप्रेशन दैट कैन बी प्रेजेंट. शॉटगन शेप ORS. Entry wound singeing SBT. What is SBT? Singeing is because of flame effect. Blackening is because of burnt gunpowder. Tattooing is because of unburnt gunpowder going in the skin. This is tattoo. These are never present in exit. Okay. Now, sir, few important words. One is Kennedy phenomena. What is Kennedy phenomena? Sir, like you got gunshot injured patient. Surgery. A person is going for surgery. Because of surgical alteration, मतलब एक आदमी ने सर्जरी की, गनशॉट इंजरी की, सर्जिकल अल्टरेशन ऑफ एंट्री वुंड or exit wound. Person has gone through the surgery. Entry wound or exit wound are altered. Now, sir, in postmortem, it becomes difficult to identify. In postmortem, it becomes difficult to identify which is entry wound and which is exit wound. Sir, this phenomena is known as Kennedy phenomena. Means, sir, very simple. Surgeon goes for surgery. Every entry and exit wound, he cleans everything. But if this person dies, sir, in postmortem, it becomes very difficult to identify which is entry wound, which is exit wound. This phenomena is Kennedy phenomena. In a very simple word, surgical alteration leading difficulty in identifying entry or exit wound is Kennedy phenomena. Surgery alteration, surgical alteration. Now, sir, very important word comes Puppet's rule. Sir, Puppet's rule is used for skull bone. In skull bone, we see fracture lines and we decide sequence of bullets. We decide sequence of bullet by fracture line. See, this is skull bone. This is first bullet fracture line. First bullet. Fracture line. This is first bullet fracture line. First. Now, the second bullet came. This is second bullet fracture line. This is second bullet. This fracture line will never cross first one. Now, third bullet fracture line. Third bullet fracture line. This is third bullet fracture line. This will never cross second as well as first. It means, sir, first is a wide fracture line. Second never crosses first. Third never crosses second as well as any other fracture line. It means, sir, by these fracture line, we can decide sequence of bullet in skull bone. This is known as Puppet's rule. This is known as Puppet's rule. सबसे वाइड फ्रैक्चर लाइन आपकी है फर्स्ट की, सेकंड नेवर क्रॉसेस फर्स्ट. हेलो, नमस्कार. मैं क्लास 5 बात करूं सर. अच्छा ठीक है, घंटा को बात करूं सर. नहीं सर, मैं आपने कॉल करूं 7:30. ठीक सर. स्कल बोन फ्रैक्चर लाइन, फर्स्ट की फ्रैक्चर लाइन आपके सबसे वाइड होती है. सेकंड नेवर क्रॉसेस फर्स्ट, थर्ड नेवर क्रॉसेस, बिकॉज जिसकी फ्रैक्चर लाइन पहले बन गई है दैट विल नॉट बी क्रॉस्ड बाय द नेक्स्ट फ्रैक्चर लाइन. थर्ड विल नेवर क्रॉस सेकंड as well as first. Fourth will never cross third as well as second as well as first. It means that by this we can decide the sequence of bullet. What is the name of this rule, my dear friend? What is the name of this rule? बोलो क्या नाम इसका? Pape's rule. Pape's rule. Doctor Saab, in a stab injury, if bullet is implanted in stab injury, डॉक्टर साहब कई बार क्या होता है आपने मारा तो चाकू से, you stabbed by a knife, but you just put a bullet. This is a artifact. And sir, this is known as Rayalaseema effect. A very important MCQ. I am expecting this MCQ, that is Rayalaseema phenomena. In a stab injury, you are putting bullet. This is known as Rayalaseema effect. Rayalaseema effect. By bullet, you have tibia fracture. By bullet, you have tibia fracture. This is a butterfly fracture. This is known as butterfly fracture. By bullet, you have a tibia fracture. This is known as butterfly fracture. There is an instrument which is known as helixometer. Helixometer is used to examine barrel of weapon. Helixometer is used to examine barrel of the weapon. Now, sir, the last word of firearm injury is beveling of skull bone. The last word of firearm injury is beveling of the skull bone. Sir, see. This is a skull bone, outer table. This is inner table. This is outer table of the skull bone. This is inner table of the skull bone. Outer table of this. This is entry wound. This is exit wound. Now, sir, this bullet is coming from here. Okay, town. Bullet is coming. This is brain. This is your brain. Brain. This bullet is entering. Whenever bullet enters, it enters as a small hole. Town. But at the exit point, it causes bursting. So this bursting is always seen at the exit point. Okay, town. Bullet is again at the entry point. It is a small hole. Okay, but again at the exit point, it causes bursting. Doctor Saab, this bursting is known as beveling. This bursting is known as beveling. So, Doctor Saab, whenever bullet enters in a table, it enters as a small hole, but at the exit point of the table, it causes bursting. At the exit point of the table, it causes bursting. This bursting is known as beveling. So, beveling is always seen at the exit point of the table. Now, I'm putting 4 questions. Write down the answer. Okay. Okay. My first question, SBT decide range of all guns. Taruja, SBT decide range of all guns because SBT is present in all entry wounds, singeing, blackening. Now, sir, see, first question. Beveling in entry wound. First question, beveling in entry wound is seen at option A, entry point of the table, exit point of the table. What is the answer? Beveling in entry wound seen at entry point of the table or exit point of the table? Yes, it is exit point. beveling in exit wound is seen at entry point of the table or exit point of the table? Entry point of the table or exit point of the table? What is the answer? Exit wound, it is seen at entry point of the table or exit point of the table? Yes, it is exit point of the table. Now listen, question carefully. Now listen, question carefully. Beveling in entry wound is seen towards inner table or outer table? Seen towards inner table or outer table? Anyone? Inner table or outer table? Yes, Dharani, it is inner table. This is inner table. Absolutely right. Beveling in exit wound is seen towards inner table or outer table? Let me get your answer. Inner table or outer table? Yes, it is outer table. It is outer table. Yes, absolutely right. तब आपको समझ में आ गया. Beveling is a bursting. Whenever bullet enters in a table, it enters as a small hole. Whenever bullet enters in a table, it enters as a small hole. But at the exit point, it makes mahol. फट जाती है. At the exit point, it is making bursting of table. This is. अब चलो आपका repetition करवाता हूँ. बहुत important है. Manufacturing company decides which marking of the bullet. Which marking of the bullet? Manufacturing company decides which marking of the bullet. Let me see. Primary marking. Firearm fingerprint on the bullet is an example of primary marking or secondary marking. Firearm fingerprint. Okay. It is secondary marking. Surgeon alters the entry wound and exit wound. What is the name of phenomena? Surgeon alters the entry wound and exit wound. What is the name of phenomena? Kennedy phenomena. Kennedy phenomena. Very good. Which instrument is used to decide the interior of the barrel? Which instrument is used to decide the interior of the barrel? Helixometer. Dr. Saab, we can see the different fracture line, first, second, third. Second never crosses first, third never crosses second. What is the name of this rule? What is the name of this rule? Puppé's rule. Very good. It is known as Puppé's rule. Very good, my dear friend. Puppé's rule.
क्वेश्चन है.
And
एक क्वेश्चन है सर.
हाँ बोलो.
सर बर्स्टिंग तो सर इनर टेबल में भी दिख रहा है, एग्जिट में, और एग्जिट में आउटर टेबल में भी दिख रहा है.
हाँ हाँ, तो यही तो बोला मैंने.
अच्छा, मतलब दोनों में दिखेगा सर?
अरे इसी देख, जब एंट्री वुंड होता है तो जब उसके एग्जिट पॉइंट में निकलता है तो उसको ब्रस्टिंग बोलते हैं. जब, अरे सीधी सी बात है तरुजा, बहुत सिंपल है. जब भी बुलेट टेबल में घुसती है तो छोटे से होल की तरह घुसती है, लेकिन जब टेबल से निकलती है तो फाड़ के निकलती है. इस फटने को बोलते हैं ब्रस्टिंग या बेवलिंग. क्या बोलते हैं इसको? ब्रस्टिंग या बेवलिंग. तो ये ब्रस्टिंग और बेवलिंग एंट्री वुंड में कौन से टेबल की तरफ है?
एंट्री में.
तो सही.
सर एंट्री में या एग्जिट में?
एंट्री पूछ रहा हूं, एंट्री.
सर इनर टेबल की तरफ.
हाँ, और एग्जिट वुंड में कौन से टेबल की तरफ है?
आउटर टेबल की तरफ.
बस. हाँ, लेकिन दोनों एग्जिट पॉइंट पे. टेबल के तो एग्जिट पॉइंट पे ना दोनों.
हाँ, टेबल के एग्जिट पॉइंट में.
यस, दैट्स व्हाट आई वाज आस्किंग.
ओके सर.
देख, सी दिस इज अ डायग्राम. ओके सर, दिस इज इनर टेबल ऑफ द स्कल बोन. ओके, this inner table of the skull bone is showing beveling. Now tell me, this is an entry wound or exit wound? Now tell me, this inner table of the skull bone showing beveling, bursting. Now tell me, it is entry wound or exit wound? I want to get your answer. Yes, absolutely right, Dharani. Absolutely right, Sanu. It is entry wound. You got the concept? Are yes or no? Are yes or no?
Got it, sir. Got it, sir.
Yes. Now, this is Puppé's rule. This is the widest. First, second never crosses first. Third will never cross second as well as. By this, we decide range of the bullet or sequence of the bullet. Range of the bullet or sequence of the bullet. Sequence of the bullet. We can decide which came first, which came second, which came third, which came fourth. Yes, this is, yes, sequence of the bullet. दामोदरन, अगर तेरे को अभी समझ में नहीं आया तो कुछ भी समझ में नहीं आएगा। स्कल बोन में 2 टेबल होती है। जब बुलेट टेबल में घुसती है तो एक छोटे से होल से घुसती है, जब निकलती है टेबल से तो वो फट जाती है। इस फटने को ब्रस्टिंग और बेवलिंग बोलते हैं। जो एंट्री वुंड में अंदर फटेगी, एग्जिट वुंड में बाहर जाते वक्त फटेगी। दैट इज इन एंट्री वुंड इट इज इनसाइड द टेबल, दैट इज इनर टेबल, एंड इन एग्जिट वुंड इट विल बी आउटसाइड द टेबल, दैट इज आउटर टेबल, एंड इट इज ऑलवेज टुवर्ड्स द एग्जिट पॉइंट। सीधी सी बात है यार, बुलेट जब टेबल में घुसती है तो छोटा सा होल बनाती है, जब निकलती है तो माहौल बनाती है। क्या बनाती है डॉक्टर साहब? माहौल बनाती है। सेकेंडरी मार्किंग आर द मार्किंग ऑन बुलेट विच इज फॉर्म्ड बाय individual firearm. This is known as secondary marking, but these can also be when you are picking the bullet by any instrument. These are also secondary marking. Okay, yes Swati, is it okay? Is it okay? Okay, फायरआर्म की जो मार्किंग होती है बुलेट पे उसको बोलते हैं सेकेंडरी मार्किंग, उसको हम फिंगरप्रिंट भी बोलते हैं, बुलेट फिंगरप्रिंट। नाउ डॉक्टर साहब, अगर आपने स्टैब इंजरी में बुलेट फिट कर दी, व्हाट इज द नेम ऑफ फिनोमिना? व्हाट इज द नेम ऑफ फिनोमिना? रायलसीमा, धरनी, एब्सोल्युटली राइट, रायलसीमा फिनोमिना। वेरी गुड। Which effect of the entry wound is because of flame effect, flame of bullet that is surrounding the entry wound? What is the name of that effect? Flame produces which effect of entry wound? क्या नाम होता है इस इफेक्ट का? फ्लेम से एंट्री वुंड में क्या बनता है? सिंजिंग, यस। बर्न्ड गन पाउडर की स्मोक से, बर्न्ड गन पाउडर जो होता है उसके धुएं से, स्मोक ऑफ द बर्न्ड गन पाउडर, विच इफेक्ट? Smoke of the burnt gunpowder forms which effect? Gunpowder forms blackening. Absolutely right. Smoke of the burnt gunpowder, it forms blackening. Very good. Unburnt gunpowder deposited surrounding the entry wound forms. Unburnt gunpowder, burnt gunpowder smoke, it causes blackening. Unburnt gunpowder surrounding the entry wound forms, yes, it is tattooing. Absolutely right, friends. Tattooing. Tattooing. Muzzle impression is seen in entry wound or exit wound? Muzzle impression can be seen in entry, because exit में तो muzzle impression होगा ही नहीं. Abrasion collar is seen in entry wound or exit wound? Abrasion collar. Abrasion collar, 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 collar.
Now,
Entry wound. Very good. Paradox gun is a modification of rifled firearm or shotgun? Paradox gun is a modification of rifled firearm or shotgun? It is a modification of. What is modified? Which gun is modified in paradox gun?
shotgun.
Shotgun is shotgun is rifled at the terminal and is known as paradox gun. Yes. Choking phenomena is used in which gun? Choking phenomena. Again, the answer is shotgun. Yes, shotgun. Again, the answer is shotgun. Now, Dr. Saab, this is a very, very important topic. हो सकता है, मेरे को नहीं लगता आपको में से किसी को बोरिंग लगा होगा. ये बहुत important topic है दोस्तों. मैंने
Interesting, sir.
इंटरेस्टिंग है ना, ये तो मस्त टॉपिक था. मेरे को लगता है फोरेंसिक मेडिसिन का सबसे इंटरेस्टिंग टॉपिक यही था.
सर ये एब्रेशन कलर एंट्री वुंड में जो पाया जाता है सर, उसका कोई पिक्चर होगा सर? सर एब्रेशन कलर बेसिकली है क्या?
एब्रेजन क्या होता है?
सर
एब्रेजन क्या होता है? कल पढ़ाया था ना. देख मेरी बात सुन. कॉलर का मतलब कॉलर का मतलब जो चारों तरफ से सराउंडिंग होती है उसको बोलते हैं कॉलर. एब्रेजन बनाती हुई कॉलर मतलब देख, दिस इज बुलेट, This will make a abrasion surrounding the entry wound, that is abrasion color, that can be present in entry wound only if the bullet is oblique. If bullet is oblique.
Okay.
है ना, टाइम होगा तो दिखा दूंगा पिक्चर, बट तुम्हारे एग्जाम में आएगा नहीं. Now, Doctor, we are coming to very important topic, that is asphyxial death. Death due to asphyxia. So what is the meaning of asphyxia? Lack of oxygen. Lack of oxygen. This is known as asphyxia. Doctor, in asphyxial death, there is a classical triad. This classical triad is known as CPC. So if CPC present, that means there is asphyxial death. What is CPC? C for cyanosis, P for petechiae, and C for congestion. Cyanosis, petechiae, and congestion. This classical triad is known as CPC. Cyanosis, everyone knows, is bluish discoloration. Cyanosis, everyone knows, is a bluish discoloration. Petechiae are pinpoint hemorrhage. Pinpoint hemorrhage. Congestion are red organs. Congestions are red organs. Red organs, red skin. This is known as CPC. Cyanosis is bluish coloration of mucous membrane in skin. This classical triad is known as CPC. Now, sir, petechiae. Petechiae are pinpoint hemorrhages. One type of petechiae is known as tardive spot. One type of petechiae are known as tardive spot. Sir, generally, tardive spot size is 0.1 to 2 mm. These are petechial hemorrhages. These are seen in neck compression and chest compression. These are seen in neck compression and chest compression, asphyxial death. Tardive spot size are 0.1 to 2 mm. These are petechial hemorrhages. And Dr. Saab, what is the site where these tardive spots are seen? Tardive spots are seen in conjunctiva. And these are seen in neck compression and chest compression. It means, sir, these two types of asphyxial death, tardive spots are seen. These two types of asphyxial death. What is the most common site of tardive spot, my dear friend? What is the most common site of tardive spot? Conjunctiva. Conjunctiva. And Dr. Saab, this is outside, it is seen in conjunctiva. Okay. But sir, inside, it is seen in visceral pleura. Inside, tardive spots are seen in visceral pleura. So if CPC is present, it is petechial, cyanosis, and congestion. These are present. It is, yes, it is asphyxial death. If cyanosis, petechiae, and congestion are present, it is a asphyxial death. Tardive spots are pinpoint hemorrhage. Tardive spots are pinpoint hemorrhage. Yes, sir. This was a very famous case. This is an example of asphyxial death. And here you can see CPC. Yes, this is cyanosis. This is petechiae, petechial. And this face is congested. Red color face. This is a classical triad of asphyxial death. Cyanosis, petechiae, and congestion. Cyanosis, petechiae, and congestion. And as I told you, my dear friend, this is tardive spot. But sir, tardive spot are petechial hemorrhage seen in conjunctiva. In which asphyxial death? All asphyxial death or death in which what is compressed, my dear friend? What is compressed? Neck and chest. It is seen in neck and chest compression. It is seen in neck and chest compression. This is known as tardiosport. So, Dr. Sahib, if you get this image, sir, tardiosport is an image of asphyxial death where neck and chest compresses. Most common site is conjunctiva. Most common site is conjunctiva. Anyways, sir, Dr. Sahib, this question comes. Tardiosports are petechial hemorrhage. These are seen in neck and chest compression. Visceral pleura and conjunctiva is the common site. Common site. Now, sir, surrounding neck. This is your neck. This is your neck. Surrounding neck, you have 4 vital structure. In front, you have trachea. Yes. In this side, you have 2 vital structure. Jugular vein and carotid artery. Jugular vein and carotid artery. And here you have in posterior part, vertebral artery. Vertebral artery. This is trachea. Now, sir, what amount of pressure is required for this structure? You can remember by a very simple mnemonic JCTV. What kilogram pressure is required to obstruct this structure? For jugular vein, 2 kilogram. For carotid artery, 5 kilogram. For trachea, 15 kilogram. For vertebral artery, 30 kilogram. This amount of pressure is required to obstruct this structure. So, Dr. Saab, you can get a question. Minimum pressure is required. You can remember by JCTV. JCTV. Now I'm putting a question. For jugular vein, how much pressure is required, my dear friend? For jugular vein, how much pressure is required? 2 kilogram to obstruct. For carotid artery, how much pressure is required? For carotid artery, how much pressure is required? 5 kilogram. For trachea, this question has come in MCA exam. For trachea, how much pressure is required? 15. And for vertebral artery, yes, my dear friend, it is 30 kilogram. 30 kilogram. Dr. minimum pressure is required to obstruct which structure? Minimum pressure for jugular vein. Maximum pressure is required to obstruct which structure? Maximum. Vertebral artery. Vertebra नहीं, vertebral artery. Vertebral artery. जो पीछे होती. Now, sir, we'll discuss asphyxial death one by one. The first asphyxial death is suffocation. First asphyxial death is suffocation. Dr. Saab, suffocation means you are getting suffocated. You are getting suffocated. दम घुटना. हिंदी में suffocation को बोलते हैं दम घुटना. Sir, it is the purest form of asphyxia. It is the purest form of asphyxia. Why do we consider it is a purest form of asphyxia? Sir, here asphyxia always take place.
नो फ्लाइट करवा देगा मेरी उसके
फ्लाइट में तो इसका काम जनरल चलता है उससे
ये
Asphyxia is always a cause of death. No other cause of death. Asphyxia is always a cause of death. This is suffocation. Dam ghutna. Dam 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 घुटता है. घुटता है. यहाँ दम घुटता है. सर, एक आदमी का दम कैसे घुटता है? You are in Delhi. You are feeling one suffocation every day. Environmental lack of oxygen. Environmental lack of oxygen. This is the first suffocation you are feeling in Delhi. Very common. Second, if any food particle goes in trachea or respiratory passages, this is choking. Second suffocation is choking. Food particle, if it goes in trachea or any respiratory passage, it is choking. Cloth piece goes in oropharynx, gagging. So in suffocation, always there will be CPC. CPC always present because it's always cause of death is asphyxia. First suffocation, आपके आसपास ऑक्सीजन की कमी. It may be a air pollution, it may be कार के अंदर पोल्यूशन, थिएटर के अंदर पोल्यूशन, घर में सिगड़ी लगा रखी उसका पोल्यूशन, अंगीठी, सिगड़ी मतलब अंगीठी. Food in trachea is choking. Cloth in, like sometimes you are putting cloth to keep mouth shut, but this cloth goes in oropharynx, that can cause gagging. Sir, oral passages and nasal passages block simultaneously. This is known as smothering. This is known as smothering. This is known as smothering. Number 5. Number 5. Traumatic asphyxia. Sir, traumatic asphyxia means trauma leading asphyxia. Trauma leading asphyxia means what happens because of trauma, your chest is fixed. Because of trauma, your chest is fixed. This is also known as plss syndrome. Sir, what are the example of traumatic asphyxia? Building collapse. If suddenly building collapses and the building material comes over the chest, this is your chest is fixed, you are not able to respirate. This is known as plss syndrome. And Dr. Saab, in this traumatic asphyxia, there is masque ecchymosis line. Masque ecchymotic line. Actually, like what this line is a demarcation between compressed area and non-compressed area, because some area will be compressed. If this chest is compressed, and there will be line between compressed and, but you just remember this is masque ecchymotic line. This is a demarcation line between compressed and non-compressed, but this you just remember masque line. Traumatic asphyxia, chest is fixed. Now, sir, number 6, that is barking. What is barking? It is combination of 4 plus 5, combination of smothering plus traumatic asphyxia. This is homicidal smothering. What is barking? See, what is barking? It is like, see, if I want to kill a small child, 5 to 6 year old child, what I will do? I'll sit on his chest and then I'll smoke. Sitting on the chest will cause traumatic asphyxia plus homicidal smothering is barking. चलो आपके सामने कुछ क्वेश्चन रखता हूं, उसके बाद हम ब्रेक लेते हैं, उसके बाद डिसाइड करेंगे. Cloth piece goes in oropharynx. What is the name of suffocation? Cloth piece goes in oropharynx. What's the name of suffocation? Gagging. A heavy building material coming over the chest or any which causing chest fixation. What is the name of this asphyxia? Traumatic asphyxia. What is another name of traumatic asphyxia? What is another name of traumatic asphyxia? plss syndrome. What is the name of demarcation line between compressed and non-compressed area? Compressed and non-compressed area in traumatic asphyxia. If you are killing a person with smothering plus traumatic asphyxia, that means you are killing by which method? That means you are killing by which method? Barking. Barking. Yes, friends, it is barking. You can see some pictures if you want to see. This is a very important one. If some pictures, yes. If any pictures here from this smothering, yes, one picture is of smothering. Yes, this is smothering. Yes, both nasal and oral passages both are blocked. This is smothering. This is smooth. Chale? So we have discussed 6 type of suffocations. The first we discussed अगर माहौल में ऑक्सीजन की कमी हो. The second we discussed choking, then gagging, then smothering, then traumatic asphyxia, then burking. ओ प्रभाकरन क्या हुआ तेरे? गर्लफ्रेंड नाराज हो गई क्या? चलो. Next is overlaying. Next suffocation, 7th number. माइक म्यूट करो रे बाजिया. What is overlaying? If your chest is compressed by heavy weight, like a mother is sleeping beside her child, her mother comes over the child's chest. This phenomena is known as overlaying. Mother is coming over child. This phenomena is known as overlaying. Chest compressed. See, in traumatic asphyxia, chest is fixed. In overlaying, chest is compressed. So that is the difference. Now 8th. Sir, 8th is cafe coronary. 8th is cafe coronary. Sir, cafe coronary word was given by Robert Hausen. Cafe coronary word was given by Robert Hausen. What happens, sir? You are intoxicated. You are under the influence of some alcohol or anything. So if you are intoxicated and your food particle goes in larynx, pharynx, your food particle goes in larynx, pharynx, and oxal, suddenly you collapses. Suddenly you collapses. Oxal, you will see the air passes and other passes are blocked. This phenomena is known as cafe coronary. Sir, what happens? The laryngeal mucosa and pharyngeal mucosa, this is blocked by food in intoxicated person. In intoxicated person, this will lead reflex vagal inhibition. This is the cause of death. Reflex vagal inhibition, that is leading cardiac arrest. This phenomena is known as cafe coronary. Again, I'm telling you, sir, cafe coronary word was given by Robert Hausen. Cafe coronary word was given by Robert Hausen, sir. But this cafe coronary is a type of choking when you are intoxicated, eating some food particle. This food particle act as a bolus, goes in larynx or pharynx, goes in larynx and pharynx. This causes sudden collapses. And Dr. what is the mechanism of this sudden collapse? Reflex vagal inhibition leading cardiac arrest. Reflex vagal inhibition leading cardiac arrest. Second cause of death may be laryngeal spasm. This phenomena is known as cafe coronary. So, but first cause of death is cardiac arrest. First cause of death is cardiac arrest. This is cafe coronary. Cafe coronary. Second cause of death is laryngeal spasm. Now I'm coming to such. See, environmental death, choking, gagging, smothering, traumatic asphyxia, burking, overlaying, intoxicated person, cafe coronary. Cafe coronary. Robert Hausen has given the word. Now, sir, next asphyxial death. This next asphyxial death is drowning. What is drowning? Drowning means your body is in water or liquid. Your body is in water or liquid. This method is known as drowning. This method is known as drowning. Fatal period for drowning is 5 to 8 minutes. 5 to 8 minutes. Mostly drowning are accidental. Most of the time of drowning is accidental. Accidental drowning are most common. Suicidal and homicidal is less common. Why it's not a good method of committing suicide? First reason, sir, fatal period is 5 to 8 minutes. Second, it's a painful death. So it is not a good method of committing suicide. Body goes in water or liquid, it is a drowning. Body goes in water and liquid, it is a drowning. Yes. Fatal period of drowning is 5 to 8 minutes. It is a painful death. It is a painful death. Painful death. Now, sir, what are the types of drowning? First, wet drowning. Sir, wet drowning is also known as typical drowning. Wet drowning is also known as typical drowning. Typical drowning. This is the most common drowning. This is the most common drowning. What is wet drowning? Wet means water goes in lungs and person dies due to cardiac arrest. Water goes in lung and person dies due to cardiac arrest. This is a wet drowning. हिंदी में बोलते हैं गीली drowning. What is the meaning of wet? Wet, water goes in lung. This is a wet drowning. Water goes in lung. This is a wet drowning. Sir, wet drowning is of two types. One is fresh water drowning and second is sea water drowning. Fresh water and sea water. Now, sir, when fresh water goes in your lung, this is pulmonary capillaries. When fresh water goes in pulmonary capillaries, when fresh water goes in pulmonary capillaries, this leads hemodilution. This leads hemodilution. To neutralize this, RBC liberate potassium ion. RBC liberates potassium ion. That will lead hyperkalemia, and hyperkalemia causes ventricular fibrillation. But sir, what happens in sea water? Sea water already contains sodium. So sea water goes inside the blood capillary. It causes hemoconcentration. Hemoconcentration. It's here sodium increases, hypernatremia, and hypernatremia causes bradycardia. Hypernatremia causes. See, again I'm revising, my dear friend. Fresh water. Again I'm revising, my dear friend. Fresh water goes in pulmonary capillaries. It is hemodilution. RBC liberates potassium. It is hyperkalemia. Hyperkalemia causes ventricular fibrillation. Sea water already contains sodium. It is hemoconcentration. Sodium, hypernatremia, and it causes bradycardia. Now, which is the faster cause of death, sir? Ventricular fibrillation is faster cause of death. It means, sir, in wet drowning, freshwater drowning, person dies earlier. And sir, in both drowning, freshwater, in both drowning, which are freshwater and seawater, there is loss of pulmonary surfactant. loss of pulmonary surfactant. We have loss of pulmonary surfactant. This is wet drowning, typical drowning, or primary drowning. Now write down, sir, atypical drowning. Atypical drowning. In atypical, first is dry drowning. What is the meaning of dry drowning? Sir, water doesn't enter in lung. In wet drowning, water enters in lung. In dry drowning, water doesn't enter in lung and person dies. Cause of death is laryngeal spasm. Larynx will constrict, my dear friend. This is the cause of death, laryngeal spasm. This is the cause of death, laryngeal spasm. Water doesn't enter in lung. Person dies due to laryngeal spasm. Laryngeal spasm. Now, second atypical drowning is, sir, remember, delayed drowning, which is also known as near drowning, which is also known as secondary drowning, and which is also known as post-immersion syndrome. Post-immersion syndrome. Sir, what happens? What happens? As the name suggests, it is delayed drowning. Delayed means person died due to delayed complication. Wet drowning, water goes in lung. Dry drowning, person died due to laryngospasm. Delayed drowning, person died due to delayed complication. What is the delayed complication? Like pneumonia, metabolic acidosis, or encephalopathy. Sir, these are complications which is seen after 1 to 2 days of drowning. It means, sir, here person not die immediately, person die after 1 to 2 days. This is delayed drowning, near drowning, secondary drowning. Post means after immersion, there is a syndrome, post-immersion syndrome. So I have told you 3 types of drowning: wet drowning, dry drowning, and delayed complication drowning. Now, third atypical drowning is hydrocution. Sir, hydrocution. I told you electrocution is electric shock. What is hydrocution? Water, cold water drowning. Cold water drowning. Where cold water enters, sir? In your ear, in your nose, in your ear, in your nose, and strike the epigastrium. Sir, it causes vagal inhibition and it causes cardiac arrest. So, sir, here cold water going in your ear, nose, and epigastrium, this is known as hydrocution. Hydrocution. Here it is also known as immersion syndrome and submersion syndrome. Immersion syndrome and submersion syndrome. Now, sir, I will ask some question to you. Write down in chat box. Which is the most common drowning? Which is the most common drowning? Anyone? Which is the most common drowning? Wet drowning is the most common drowning. In which drowning person dies due to laryngeal spasm? In which drowning person dies due to laryngeal spasm? Dry drowning. What is the cause of death in cold water drowning? What is the cause of death in cold water drowning? cold water drowning. Vagal inhibition leading cardiac arrest. Hemodilution and hyperkalemia is a feature of freshwater drowning or seawater drowning. Freshwater drowning or seawater drowning. Freshwater drowning. Which is a faster death? Freshwater or seawater? Immersion syndrome and submersion syndrome are other name of which drowning? Immersion syndrome and submersion syndrome are other name of which drowning? Hydro question. Absolutely right, my dear friends. Now, sir, come to postmortem finding. Sir, when we are starting postmortem finding, means after death, what are the change? First, we should know what is antemortem drowning. Sir, what is antemortem drowning? Antemortem. And what is postmortem drowning? Postmortem drowning means after death, if body is put inside water. After death, body is put inside water. And antemortem drowning means death inside water. Death inside water. Now, sir, what are the findings which suggest that person died inside the water in dead body? These are the findings of antemortem drowning. Death inside water. Now, sir, first finding, cadaveric spasm. What is cadaveric spasm? A person struggles in water. Person struggles in water and hand remain clenched. Clenched hand with some grass particle. With some grass particle. Sir, this suggests that person struggled in water. Cadaveric spasm. Cadaveric is a dead body. Cadaveric spasm. That suggests you struggle in water and you have clenched hand with grass particle. This phenomena is known as cadaveric spasm. That suggests you died. This is the most characteristic finding of antemortem drowning. First phenomena, cadaveric spasm. Cadaveric spasm. Second, water present in GI tract. Water present in GI tract, stomach and intestine. That is also suggestive of antemortem drowning. Antemortem drowning. Third, water in lungs. Sir, what happens when water goes in lungs? Lungs are heavy. This is known as emphysema aquosum. Sir, everyone knows emphysema is a word used for lung and aquosum is water, aqueous. But sir, here lungs has frothy water. Lungs has frothy water. This condition is known as emphysema aquosum. Water in lung, there is a subpleural hemorrhage that suggests that you have water in lung. Subpleural hemorrhage. It is known as Pultoff hemorrhage. This also suggests water in lung. Subpleural hemorrhage is known as Pultoff hemorrhage. Water goes in the lung with your respiration. And also when water goes in your lung, there is mucoid frothing. Comes from your nose and mouth. Mucoid frothing comes from your nose and mouth, this also suggests antemortem drowning. This also suggests antemortem drowning. Antemortem drowning. So again, I'm revising, my dear friend. Lungs are heavy with water. It is emphysema aquosum. Subpleural hemorrhage is Pulthoff hemorrhage. Mucoid frothing from nose and mouth. It is also suggestive of antemortem drowning. What is antemortem drowning? Person was alive in water and then person died inside the water. So water in GI tract, water in lung, and cadaveric spasm. Most characteristic finding is cadaveric spasm. Now fourth finding, Jettler test. Jettler test is chloride ion in heart chamber. Chloride ion in heart chamber. This is also important finding of antemortem drowning. Jettler test. Diatom test. Chloride ion in heart chamber. This is also a very important finding. Jettler test. Diatoms are unicellular algae. Diatoms are unicellular algae covered by silica. And sir, along with the water, diatom goes in your lungs, then it goes to different organs. Sir, best organ for detection of diatom is bone. And in bone, best bone is femur. Then second is sternum. That's very simple, sir. In water, we have algae. These are known as diatom. Diatom goes in your lung. From lung, it goes to the systemic circulation. Best organ is bone. And in bone, best organ is femur. In bone, best organ is femur. Second is sternum. And Dr. Saab, for diatom, we do acid digestion test. For diatom, we do acid digestion test. Dr. Saab, in acid, bone is digested, but diatom not. That is known as acid digestion test. Acid digestion test. This is also a very important finding of antemortem drowning. Antemortem drowning. Number 6, Sveshnikov sign. How to remember, sir? As for Sveshnikov, as for sinus contain water, your sinus contain water, this sign is known as Sveshnikov sign. Nasal sinus contain water. Paranasal or nasal sinus. Next is Sabinski sign. Sabinski sign. Now, what is the trick to remember? As for Sabinski, as for small spleen, spleen size is small, has become after drowning. This is known as Sabinski sign. Sabinski sign. 8th is Sehat sign. Sehat sign. As for Sehat, as for stomach mucosa rupture. So डॉक्टर साहब मैंने ट्रिक बहुत इजी बनाई है. As for Sveshnikov sign, is water present in sinus. Sabinski sign, spleen become small. Sehat sign, stomach mucosa rupture. S. These all are the finding of antemortem drowning. What is antemortem drowning? Person died inside the water is antemortem drowning. Again, I am telling you, sir, what are the finding of antemortem drowning? When you are inside the water, you will struggle. There will be grass in the clenched hand. This is cadaveric spasm, most characteristic. Water in GI tract, water in lung, producing mucoid frothing from this area. Mucoid frothing from this area. Yes. Then simple Pulthoff hemorrhage in subpleural lesion and lungs are heavy. Gentler test are chloride ion detection test. Chloride ion detection test is a gentler test. Okay. Diatoms are unicellular algae present. Diatoms are unicellular algae. Yes, unicellular algae. These are, along with the water, it goes in lung. From lung, it goes to the organs. These are known as diatom test. And acid digestion test is detect for diatom. It is a method by which you detect the diatom. As for Svesh, ये तीनों PG के क्वेश्चन है. Sveshnikov sign, water in sinus. Sabinski sign, small spleen. Sehed sign, stomach mucosa rupture. These are also seen in antemortem drowning. But sir, now we are coming to the finding which is seen in antemortem drowning plus postmortem drowning. Antemortem drowning plus postmortem drowning. First is flotation. Antemortem means you died inside the water. Postmortem means you died outside, but body has been put inside after that. Now, sir, this is water. Your body is inside the water. After some time, there is gas formation. Gas formation in the body because of decomposition. And body will start floating. Body will start floating. Now, Dr. Saab, this flotation time in summer is 24 hours and in winter, sir, it is 1 to 2 days. And in winter, it is 1 to 2 days. Why in winter it is more? Because, sir, in winter decomposition is slow. In winter decomposition is slow. That's why flotation time is more in winter. But sir, flotation time, flotation of the body is seen in old drowning, antemortem and postmortem drowning, doesn't matter. Now, another finding which is seen in antemortem and postmortem drowning is washerwoman hand. It is washerwoman hand. Sir, what is washerwoman hand? It is skin change of palm and sole. It is skin change of palm and sole. Dr. Saab, doesn't matter you died inside the water, outside the water, but your body is in water. Your body is in water. So what will be the changes? This is known as washerwoman hand. Washerwoman hand. Sir, there will be wrinkling. There will be wrinkling. Yes, can you see the slide? There will be wrinkling. Okay. There will be thickening of the skin and degloving. Degloving means the skin will be peeled off. So these changes are known as washerwoman hand. These are seen in antemortem as well as postmortem drowning. These are known as skin and palm and sole. Skin becomes wrinkled, thickened, degloving of the skin. Skin is peeled off. This is known as washerwoman hand. This is known as washerwoman hand. This is seen in antemortem as well as postmortem drowning. Antemortem and postmortem drowning. Washerwoman hand. चलो सर कुछ सवाल पूछता हूं. Write down. Okay. First question. Diatoms are what? Unicellular. 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 Diatoms are what? Unicellular algae. Okay, very good. Algae. What is the covering of diatom? Diatom किससे cover होते हैं? Silica. Diatoms are covered by silica. Which is the best site to detect diatom in your body after drowning? Best site, best organ. Bones. Which is the best bone? Which is the best bone? Femur. Femur. In Jettler test, what we detect, where we detect? What we detect, where we detect? In Jettler test. Chloride ion in heart chamber. Which finding is present in antemortem as well as postmortem drowning? Which finding is present in antemortem as well as postmortem drowning? Which hand? Washer woman hand. Washer woman hand is present in antemortem as well as postmortem drowning. Doctor, what is the name of hemorrhage because of water entry in lung? What is the name of hemorrhage because of water entry in lung? Yes. Subpleural hemorrhage known as Pultoff hemorrhage. Pultoff hemorrhage. Now drowning, we have frothing from nose and mouth. This frothing is mucoid or non-mucoid frothing? Mucoid and non-mucoid. It is mucoid. What is the most characteristic finding of antemortem drowning? What is the most characteristic finding of antemortem drowning which decide the person died inside the water? Antemortem drowning. Cadaveric spasm. Cadaveric spasm. Small spleen in drowning, what is the name of sign? Small spleen in drowning, what is the name of sign? Yes, it is Sabinski sign. Stomach mucosa rupture, what is the name of sign? S stomach, S for Sehet sign. Paranasal sinus contain water, what's the name of sign? Paranasal sinus contain water, what is the name of sign? Sveshnikov sign. Very good, my dear friend. Very, very good. So these are some very, very important MCQ which are generally being asked in exam regarding drowning. Now, sir, I'm coming to those asphyxial death method where neck get compressed. Neck compression method where we are coming to those asphyxial method where neck gets compressed. Neck get drowning is not a purest sign of asphyxia. Drowning, actually in drowning, death is due to many reasons, not only asphyxia. Sir, there may be other causes also. There may be cardiac arrest, there may be laryngeal spasm, there may be vagal inhibition. That's why I told you it's not the purest form of asphyxia. Maybe other causes. Cardiac arrest is very common in wet drowning. Now I'm coming to neck compression. Sir, see, neck compression asphyxial death are two types. One is hanging, another is strangulation. One is hanging, another is strangulation. In both cases, neck is compressed. Sir, what is first? We'll discuss hanging. Hanging is neck compression plus body suspension. Neck compression plus body suspension. It means, sir, if your neck is compressed with your body suspension, this phenomena is known as hanging. This phenomena is known as hanging. Like, see what you do. You apply this surrounding the neck, then you hang your body suspension. This is known as hanging. Sir, mostly hanging are suicidal. Mostly hanging are suicidal. So this was washerwoman hand. I have shown you this picture. And so this image, which I didn't show you, this is cadaveric spasm. I told you. Most characteristic finding of ante-mortem drowning. Okay, anyways. So now I'm coming to hanging. Hanging is suspension. Hanging is body suspension plus neck compression. And doctor, mostly hanging is suicidal. Hanging is mostly suicidal. Suicidal means you commit suicide, you are putting dupatta, or like Sushant Singh Rajput committed suicide. Mostly hanging are suicidal. But sometimes it may be accidental, judicial, which is in practice in India, and very rare homicidal. Very rare homicidal. You commit suicidal. You die accidentally, that is accidental. Government kills you, that is judicial. Yes. And some other person hang you, that is homicide. But sir, most common is suicidal. Why it is most common, sir? Here, fatal period. What was the fatal period in drowning, anyone? What was the fatal period in drowning? What was the fatal period in drowning, anyone? 5 to 8 minutes. Okay, 5 to 8 minutes. Sir, in suicidal hanging, fatal period is 3 to 5 minutes, very less. And Dr. Saab, it is almost painless method. It is almost painless method, no pain. So it is suicidal is very common because it's painless method. Most common method of suicide in India. Most common method of suicide in India is hanging. Suicide means suicidal death. Person die. Most common method of suicide in India, it is hanging. Now, sir, I will put few terms. This is suicide. That is suicidal death. Most common method. Now, second question. Most common method of para-suicide. Now, sir, this question comes. What is para-suicide? Para-suicide is attempted suicide. Para-suicide is attempted suicide. Attempted means you survived. You attempted, but you have not died. You survived. The most common method of para-suicide is drug or poison. Is drug or poison. Drug or poison. So this is first suicide. This is para-suicide. Now come to complex suicide. What is the meaning of complex suicide? More than one suicide method you use. More than one method, not equal, more than one method. More than one method of suicide you use to ensure the death. To ensure the death. This is complex suicide. This is complex suicide. This is complex suicide. And what is complicated suicide? Sir, you attempt one method. You attempt one method, but you die due to unintentional. You die due to unintentional trauma. This is complicated suicide. Now I will ask you a few questions. Sir, first question. You attempted hanging method. You attempted hanging method and you die from fall from height. What is the name of this suicide? complicated. Absolutely right. It is complicated. You attempted two methods for committing suicide. One is wrist cutting. Second is poison. What is the name of this suicide? Yes, it is complex suicide. You attempted suicide method, but you survived. What is the name of this method? You attempted suicide, but you survived. What is the name of this method? Para-suicide. Yes, you got the concept. I think you got the concept. But sir, in India, most common method of suicide is hanging. Most common method of suicide is hanging. Now, sir, I am coming to types of hanging. One is complete hanging. Complete hanging. Sir, whole body suspended. Whole body suspended. It is complete hanging. Second is incomplete hanging. Incomplete hanging is also known as partial hanging. Partial hanging, some part of the body touching the ground. Some part of the body touching the ground. This is partial hanging or incomplete hanging. Now, sir, third hanging is typical hanging. If knot is present at occiput, knot is present at occiput, this is a typical hanging. Knot is this knot, this one. This present at occiput, this is a typical hanging. Not at any other place. Not at any other place. This is a atypical hanging. Not at any other place. It is a atypical hanging. I will show you the picture because pictures are also important. See, knot is at occiput. This is a typical hanging. And sir, knot. This is the knot. This is the knot. These are example of atypical hanging. These are the example of atypical. Not at occiput, this one. This is a typical hanging. Not at any other place. This would be atypical hanging. Atypical hanging. Not succeed. This is if part of the body touching the ground. This is partial hanging, and partial is also known as incomplete hanging. So we have classified hanging in these categories. We have classified hanging in these categories: complete, incomplete, typical, atypical. Complete, incomplete, typical, and atypical. Typical not at occiput, atypical not at any other place. Not at any other place. Now, sir, most common cause of death in hanging is asphyxia plus venous congestion. Asphyxia plus venous congestion, that is most common cause of death. Please mute your mic. Asphyxia plus venous congestion. Now, sir, come to postmortem changes. What are the findings which you have to see? Sir, I have already told you, in hanging, first cavity has to be opened. It should be cranium. And last cavity, it should be opened in all asphyxial death. Doesn't matter it's hanging, it's neck. Neck. Now, sir, hanging most of the time, cause of death is asphyxia. So CPC is cyanosis, petechian congestion. CPC is cyanosis, petechian congestion. This can be present, this can be absent. CPC is cyanosis, petechian congestion. Tardive spot, I already told you, those asphyxial death where neck is compressed, tardive spot can be present, as I told you. Conjunctiva is the most common site. Protrusion of tongue. Sir, it can be present. Sir, why protrusion of tongue? See, if we are using this goes up and creates pressure on mandible. This creates protrusion of tongue. That can be present. Protrusion of tongue. Hyoid bone fracture only in 10% cases, not more than this. Hyoid bone fracture in only 10. And also, see, the pressure is generally anterior to posterior. This one. It is antero-posterior fracture. It is, see, antero-posterior fracture, or it is abduction fracture. Antero-posterior fracture, or you can see pressure will be from antero-posterior fracture or abduction fracture. Abduction fracture. Now, sir, most specific finding of hanging, we have to see ligature mark. Ligature mark on neck. See, this is your neck. This is your neck. Whatever you are using, dupatta or whatever it is, generally ligature mark is V shape, like this. V shape. Sir, it goes up. So this mark is above thyroid. Above thyroid. Generally, this mark is incomplete. Why it is incomplete, sir? Because at the place of knot, it is absent. At the place of knot, it is absent. And this ligature mark is pressure abrasion. This ligature mark is pressure abrasion. So what you will do? This will be V shape above thyroid. It is a pressure abrasion. So what you will do, my dear friend, you will dissect this ligature mark. After dissection, because it is an abrasion, it's a sliding pressure abrasion, you will find pale and glistening area after dissection of this ligature mark. Because this injury is abrasion, you will find pale and glistening area. Pale and glistening area. Why? Because it's abrasion. This is a finding in ligature mark. Finding in ligature mark. Another important finding, that is ligature mark. So generally it is a V shape. So doctor, we have seen, you can find sign of asphyxia, CPC. You can find protrusion of tongue. You can find hyoid bone fracture as abduction fracture in few cases. You can find ligature mark. But sir, till now we have not seen any finding which is significant for antemortem hanging. These findings are present in antemortem and postmortem also. So we are coming to a very important word, antemortem hanging. What is the meaning of antemortem hanging? That person died due to hanging. Person died due to hanging. Now, sir, see. So this is a person. This is the neck. This is not. Sir, see. On the both side, if we have two submandibular gland, this one gland, this is second gland. Submandibular gland. Sir, what will happen? See, if I have knot here, maximum pressure will be on opposite side of knot. This will compress this submandibular gland, saliva will dribble. So, on the opposite side of knot, there is dribbling of saliva. Dribbling of saliva. Why on opposite side of knot? Sir, because maximum pressure will be on opposite side of knot. And Dr. Saab, this is the most characteristic finding of ante-mortem hanging? Sir, it suggests that person died due to hanging, because after death, if you are hanging in the body, saliva is never dribbled. So dribbling of saliva is most characteristic finding of ante-mortem hanging. Dribbling of saliva is the most characteristic finding of ante-mortem hanging. Now, sir, on the same side of knot, eye is open, pupil is dilated. On the same side of knot, eye is open and pupil is dilated. This is a different finding. This is known as la facie sympathetique. On the same side of knot, eye is open and pupil is no, Dr. No, Doc Vicky. It is not, dribbling of saliva is not present in all ante-mortem hanging. First of all, it is not seen in all ante-mortem hanging. It is seen in few ante-mortem hanging, but if it is present, it is the most characteristic finding. Because saliva, like if you are not at posterior part, okay, saliva will dribble on the ground. If you are not here on lateral part, maximum pressure will be on the opposite side, you can have dribble. So it is not seen in all finding, but if it is present, it is the most characteristic finding. Now on the same side of knot, that's a very important point. On the same side of knot, eye remain open and pupil is dilated. This is the knot. This eye will remain open. Opposite side will be closed and pupil is dilated. This finding is known as la facie sympathetique. It is because of sympathetic chain stimulation. It is known as la facie sympathetique. La facie sympathetique. Another important finding. La facie sympathetique. Anyway, sir, we have seen some very, very important finding of hanging. Okay. In hanging, we can have Simon hemorrhage. Simon hemorrhage is hemorrhage in intervertebral disc of lumbar region. Hemorrhage in intervertebral disc of lumbar region. Simon hemorrhage is hemorrhage in intervertebral disc of lumbar region. This is known as Simon hemorrhage. Anyway, sir, now I am putting some question to you. You have to give answer. First, dribbling of saliva is due to compression of which gland? Which gland? Dribbling of saliva is due to compression of which gland? First question. Which gland? Yes, it is submandibular. Which is the most specific finding of hanging? Most specific finding of hanging. Hanging. I have not used word ante-mortem hanging. I have used just word hanging. Most specific find of hanging, by which you can say it's a hanging. Ligature mark. Which is the most characteristic finding of ante-mortem hanging? Listen carefully. Ante-mortem hanging. Ante-mortem hanging. Yes, dribbling of saliva. Dribbling of saliva. In hanging, hyoid bone fracture is abduction or adduction? Abduction or adduction? Hyoid bone fracture is abduction or adduction? Abduction. Absolutely right, my dear friend. I love you all. भाई साहब आप सब हीरा हो. अब सर सवाल उठता है, this we have Simon hemorrhage is intervertebral disc hemorrhage of lumbar vertebra. Okay. Now, sir, we have discussed suicidal hanging. Second hanging is homicidal. Sir, as I told you, homicidal hanging is rare. It is not common. Why it's rare, sir? First of all, if we want to hang someone, we need some people, 6 or 7 people to hang. That's why it is rare. Sir, one method is known as lynching. Lynching method is generally practiced in North America. North America. Here, white person used to hang. White person used to hang black person on tree. This method is known as lynching. This method is known as lynching. So lynching is not very common. Yes, lynching is not very common. White person used to hang black person on tree. This method is known as lynching. So homicidal hanging is there. Now, sir, third hanging is sexual asphyxia. Now, sir, what is sexual asphyxia? Sir, see, you are using sexual perversion. You are using some sexual perversion like masochism. Masochism is self-suffering, or transvestism. These two people, they apply some ligature material on the neck and they want perversion, but unfortunately they get asphyxia. They are involved in the sexual perversion method, masochism and transvestism. They apply some ligature material and they hang their body, but they want some hypoxia, but they get sexual asphyxia. Sir, sexual asphyxia is also known as autoerotic asphyxia, and in few countries it is known as Kodzvarism. In few countries it is known as Kodzvarism. Now tell me anyone, this death will be because a person is not going for suicide. Person wants sexual pleasure. He is applying some ligature material for sexual pleasure only, but unfortunately he get asphyxia. Now tell me, this hanging is suicidal, homicidal, or accidental? This hanging is suicidal, homicidal, or accidental? Anyone? Yes, yes, absolutely, because the person doesn't want to die, person wants sexual pleasure. So Dr. Saab, sexual asphyxial death is a accidental hanging. It is known as Kodzvarism. It is known as autoerotic asphyxia. Kodzvarism or autoerotic asphyxia. Now I am coming to, sir, the last but not the least, judicial hanging. Sir, Indian government used this method for killing criminals, for execution, for killing criminals. Recently, we have seen 4 accused of Nirbhaya case died by this method, judicial hanging. Sir, this hanging is complete hanging, first of all. This hanging is atypical hanging, second. And here we have sudden drop. Here we have sudden drop. Suddenly person drops. Actually, sir, what is this method? See, this is a person. He is standing on a platform. This platform shifted. Dr. Saab, this is judicial hanging. So this person suspended when platform shifted. This is a complete hanging. Atypical hanging. Sir, why it is used as a word atypical hanging? Atypical hanging. Sir, because knot in judicial hanging is present on the left angle of mandible, just below ear, suboral. This one, this area. Left angle of mandible or lateral part of the neck. Here it is fixed here, left side. This is known as hangman knot. This is known as hangman knot. Left angle of mandible, it is fixed here. This is known as hangman knot. So what happens? This create pressure. Then there is a C2, C3 vertebra fracture, brain stem damage. C2, C3 vertebra fracture, brain stem damage, and Dr. Saab, specifically this C2 vertebra fracture, this is known as hangman fracture. Specifically, this C2 vertebra fracture is known as hangman fracture. Hangman fracture. Dr. Saab, because of sudden drop, carotid artery tear is very common. This is known as IMG sign. This is known as IMG sign. Carotid artery tear is very common. This is known as IMG sign. Again, I am revising, my dear friend. See, not present at left angle of mandible. It is suboral lesion that create pressure. C2 and C3 vertebra fracture. C2 vertebra fracture is also known as hangman fracture. Carotid artery tear. This sign is IMG sign. This sign is IMG sign. See, this is a complete hanging, atypical hanging. But Dr. Saab, sometime a question comes. I am putting two questions. And first question, hangman fracture is fracture of which vertebra? Hangman fracture is fracture of which vertebra? Which vertebra? Hangman fracture. No, C2, C3 is right answer, but specifically C2. Specifically C2. Okay. Hangman not present on which side? Right or left? Right or left? Left. Anterior part or lateral part? Anterior part or lateral part? Lateral. That is left lateral, just below angle of mandible, suboral. Sir, in India we are putting not here, but in other country you will get the answer hangman not. You will get that answer. Other countries, not is placed below chin. Not in India. Not is placed below chin. In India we are putting in that part, but in other country, not is placed below chin here. That's a different. Anyway, sir, this is all about hanging. Now I am coming to, sir, very, very important topic, that is strangulation. That is strangulation. Strangulation. Sir, what is strangulation? How do we differentiate it from hanging? Sir, it is only neck compression, no suspension of the body. It is only neck compression, no suspension of the body. No suspension of the body, only neck compression. This is strangulation. Okay. Only neck compression, no suspension of the body. So mostly strangulation are homicidal. Generally, if you are compressing the neck, there is no suspension, it means you are killing. Homicidal, may be accidental, may be judicial, may be accidental, may be judicial, but suicidal is very rare. Suicide is very rare. You cannot commit suicide by this method. Like by this method, you cannot commit suicide. It is mostly homicidal, maybe accidental. Now, what are homicidal strangulation? Number one, ligature strangulation. Wherever I write down ST, that will be strangulation. By ligature, you are compressing the neck. Second, manual strangulation. Manual means this. This is manual. Manual strangulation. This method is known as throttling. Manual strangulation. This method is known as throttling. Manual. Elbow strangulation. This is known as mugging. And strangulation by using stick. This is known as benzodola. Strangulation using stick. This means this is ligature. You are killing someone by this method. This is ligature. This is manual. This is mugging. This one. mugging, and between stick, this is Bencidor. Now, Dr. Saab, see, this ligature strangulation can be accidental. Yes, sometimes this ligature strangulation can be accidental. Female sometimes not killed by someone, but female going somewhere and getting strangled by dupatta or chunni. That may be accidental. Even, sir, mugging can also be accidental. Like I'm a mother, I'm holding my child, and suddenly child neck comes in this elbow. This can also be accidental. Even between stick, this one, this can also be accidental. But sir, throttling is never accidental. It is always homicidal. Throttling is never accidental. Dr. Sir, if you are holding the neck till death, it means you want to kill that. If you are holding the neck till death, that means you want to kill that. Okay, so throttling is never, this is always homicidal. Throttling is always. Now I will show you the picture of, you can get this picture. See, this is mugging. This one. This is mugging. This is in elbow, you are killing. This method is mugging. This is throttling. This is mugging. Throttling and mugging. Throttling and mugging. Now, sir, so these are the example of homicidal strangulation. Now I am coming to judicial strangulation. Judicial strangulation. Sir, in India, we have judicial hanging, but there are certain countries we have judicial strangulation. These countries are Spain and Turkey. Spain and Turkey. Sir, this method is known as Spanish windlass method. And here, this method is also known as garroting. This method is also known as garroting. This method is also, now you can see this picture. See, this is not a hanging. This is judicial strangulation, my dear. Judicial strangulation. The person is sitting. This is a metallic collar. They compress the neck. This is judicial strangulation. This is a metallic collar. This is known as, because this is common in Spain and Turkey, that's why it is known as Spanish windlass method. And Dr. This is judicial. This is also homicidal. It is, every judicial method is a homicidal also, because you are killing a person. But why do we use word judicial first? Because it is mainly judicial. Criminals are killed by this method. Criminals are killed by this method. This is judicial strangulation. Dr. This is judicial strangulation method, that is garroting. This is judicial strangulation method. This is known as garroting. Garroting. Now, sir, anyways, we have discussed what are homicidal, suicidal, all methods. Now come to the postmortem changes. Come to the postmortem changes. Sir, same thing. CPC may be present, may be absent. If the person died due to asphyxia, there is CPC. If not asphyxial sign, CPC may be absent. Tardive spot, generally present, because it is, if neck compression is there, tardive spots generally present. Tardive spots generally present. Sir, very important. When you kill someone, there are chances of resistance injuries. When you kill someone, there are chances of resistance injury may be present, plus minus. If the person is conscious, he will resist. Thyroid fracture may be present. Thyroid fracture may be present. Thyroid fracture may be present. It is more common. Actually, so thyroid fracture may also be present in hanging, but thyroid fracture is more common than hanging in strangulation. Hanging is rare. Hanging is rare. It is rare. Thyroid fracture. Now come to a very specific finding, my dear friend, that is ligature mark. because by which we differentiate. See, this is your neck. This is your neck. Ligature mark is generally transverse. Ligature mark is generally transverse, complete. Ligature mark is transverse, complete, or at the level of thyroid or below. At the level of thyroid or below this. In hanging, it was above and dorsal. Actually, this is compression of neck by you, so that will produce injury, sir. There may be periligature, surrounding ligature. There may be periligature injuries or hemorrhage. Periligature injuries or hemorrhage. Periligature and injuries or hemorrhage. And Dr. Saab, again I'm telling you, sir, you are compressing the neck. That's why CPC sign is more prominent, because you are compressing the neck. Extra pressure is created. Cyanosis, fatigue, and congestion are more prominent. Asphyxial sign are more prominent. More prominent. Yes. Now, Dr. Saab, when you dissect this ligature mark, this question comes in exam, because this is an injury, my dear friend. When you dissect ligature mark, there will be hematomas of muscles, bruise of the muscles in neck. When you dissect the ligature mark, muscles of the neck, bruise of the neck muscles, hematoma of the neck muscle, you will find muscle hematoma, you will find other hematoma, you will find bruise. These are commonly seen. Dr. Saab, again I am telling you, generally this is transverse, complete, periligature injuries. After dissection, you will find hematoma, bruise of the muscles, hematoma of the tissue, bruise of the tissue, you will find. This is a very important, significant finding, my dear friend. Ligature mark. Ligature mark. Very important, significant finding in strangulation. That is ligature mark. Ligature mark. Here, hyoid bone fracture is not common. In this strangulation, hyoid bone fracture is not common. Here, thyroid bone fracture is more common than hanging. And observe, thyroid bone fracture is commonly in superior horn. Superior horn. This is common. Fracture of thyroid bone fracture is superior. So, how do we differentiate, sir? There will be transverse ligature mark, periligature injury, complete mark. Chances are there, complete mark. After dissection, you will find hematoma or bruise in muscles, tissue beneath the ligature mark. This is very, very important finding, my dear friend. Very. And CPC. Why CPC is more prominent, sir? You are compressing the neck. So you are resisting. You will apply more pressure. Chances of cyanosis, fatigue, and congestion are more prominent. Are more prominent. Now I am coming to throttling. See. Sir, throttling is compression of neck by hand. It is always homicidal. It is always homicidal. There is no chance of accidental throttling. Now, sir, T. How to remember? Here we have thyroid fracture. Okay, good. And here we also have, sir, hyoid bone fracture. That is a very important part. Hyoid bone fracture is not very common in ligature strangulation, but in throttling it's common. Hyoid bone fracture is in 50% cases. And Dr. Saab, this is inward compression fracture. This is inward compression fracture or adduction fracture. Inward compression fracture or adduction fracture. See, that will cause this. You can see this. It is inward compression. This is adduction. Adduction का मतलब पास में आना. Adduction. In hanging it was abduction. Abduction. It is adduction. Sir, multiple bruise on the neck, which are 6 penny bruise, coin-shaped bruise, can be present. After dissection of bruise, you will find hematoma. Yes, bruise has hematoma. Hematoma. And nail abrasion. If a person compressing the neck has big nail abrasion, which are semilunar abrasion. Which are semi-lunar abrasion or crescentric abrasion. I will show you the picture of all three. Semi-lunar or crescentric abrasion. Doctor, sometime what type of question you get? Listen, what type of question you get? Like I'm giving first picture to you. See, first picture to you. This one. If you get this kind of picture, sir, see, if you get this kind of picture where multiple bruise on the neck, this one, multiple bruise on the neck, yes, this picture, you can see this bruise, this bruise, this bruise, this bruise, multiple bruise. There is no fixed ligature mark. Multiple bruise, these are 6 penny bruise. When you dissect, you can find hematoma, multiple bruise. And even, sir, sometimes neck dissection picture is given here. And in neck dissection, you will have hematoma. That suggests this is throttling. And maybe nail abrasion, which are semi-lunar or crescentric. Maybe nail abrasion, which are semi-lunar or crescentric. Now I will show you one picture how to see, how to differentiate it from strangulation ligature mark. You can see. I will show you the picture of strangulation ligature mark. See, this is a very important picture. You can see. Now, how would you see this one? Okay. Let me show you. Let me show you. This is a very important picture. You can get this snapshot of this picture. Yes. You can see. You can see, sir. This is a very simple mark which is almost transverse. Transverse ligature mark. Transverse. It is not V shape. It is transverse ligature mark. You can see some injury periligature. You can see some periligature injury. You can see this injury, this injury. These are periligature injury. This is ligature strangulation. This is ligature strangulation. Okay, just get this picture. Now in hanging, what picture you get? Hanging ligature mark. Okay. Now, sir, see, in hanging ligature mark, you generally see V-shaped picture like this. V-shaped picture. V-shaped picture. And if it is V-shaped picture, that suggests this one. You can see this is V-shaped picture. This suggests this is hanging ligature mark. You can see this one going upwards towards neck, towards ear. This is hanging picture, hanging ligature. Okay. But sir, main thing to differentiate, because sometimes V shape, O shape mark can be seen in both. To differentiate, you have to dissect. To differentiate, you have to dissect. If after dissection you have hematoma, after dissection you have hematoma, that is strangulation. That is strangulation. After dissection, it is a pale and glistening area, that is hanging. So strangulation will show hematoma. Strangulation will show hematoma. Hematoma. So that is a very, very important finding. Be careful. You will find hematoma. You will find hematoma after strangulation, after throttling, because these are the common findings which are seen as hematoma of neck structure. Hematoma of neck structure. Anyway, sir, that is a very simple way to differentiate. Very, very simple way to differentiate. Now, I'm putting some question. Write down. This is okay. Write down some rapid revision program. Hangman fracture is a fracture of which vertebra? Hangman fracture is a fracture of which vertebra? Write down. C2. MUSET sign is more commonly seen in which hanging? MUSET sign, carotid artery tear, is more commonly seen in which hanging? MUSET sign, more commonly seen in which hanging? MUSET sign. Judicial hanging. Yes, Elaraba, you are absolutely right. It is judicial hanging. MUSET sign is more commonly seen in judicial hanging. Very good. Okay. Very good. Very good. It is more commonly seen in judicial hanging. Okay. Lumbar intervertebral disc hemorrhage in hanging is known as which hemorrhage? Lumbar intervertebral disc hemorrhage in hanging is known as Simon hemorrhage. Very good. Dribbling of saliva is seen on same side of the knot or opposite side of the knot? Same side of the knot or opposite side of the knot? Opposite side of the knot. In La facies sympathetic, same side of eye is opened or pupil is dilated or opposite side? La facies sympathetic. Yes, Afshan, it is same side, eye is open and pupil is dilated. Absolutely right. Which is the most common suicide method in India? Hanging. Hanging is the right answer. Which is the most common method of para-suicide in India? Para-suicide. Para-suicide. I want to get the answer. Drug or poison? Yes, Bharat, absolutely right. Drug or poison. Most common method of para-suicide is drug or poison. Adduction, ADD. Adduction hyoid bone fracture is seen in. Adduction hyoid bone fracture is seen in. Hanging or throttling? Adduction, throttling. Now listen carefully. Listen carefully. Hyoid bone fracture is more common in. Option A is hanging. Option B is throttling. Hyoid bone fracture is more common in hanging or throttling. What will be the answer? Yes, throttling it is 50% cases. Hanging it is 10% cases. Okay. Which is the first cavity to be opened in asphyxial death? First cavity to be opened in asphyxial death. Anyone? Yesterday I discussed. First cavity to be opened in asphyxial death. Which is the last? Everyone knows it is. Yes, first is cranium, last is neck. First is cranium, last is neck. Absolutely right. Very good. What is the name of this strangulation method? This mugging. What is the name of this strangulation method? Throttling. In Spain and Turkey, criminals are killed by which method of strangulation? What is the name of that method? Garroting. 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 Absolutely right, friends. Absolutely right. Most common method is garroting. Yes. Now, sir, tell me, asphyxial signs are more prominent in hanging or strangulation? Asphyxial signs, CPC, are more prominent in hanging or strangulation?
Strangulation.
Strangulation. Because here compression of the neck is more, that's why the signs are more prominent in strangulation. Very good. 6 penny bruise on the neck with semilunar crescentic abrasion by nail are seen in 6 penny bruise, throttling. Yes, Damodaran, it is throttling. Throttling. Okay, very good. Okay. Anyway, sir, this is all about a very, very important topic we discussed. This was asphyxial death. Now I'm coming to another important topic, friends. Yes. Identification. The next topic is identification. Sir, identification is very important part, and there is a word which is known as corpus delicti. There we have a word. This word is known as corpus delicti. What is the meaning of corpus delicti? Sir, corpus means body. Corpus means body. And delicti means offense. It means, what is the meaning of this? If any offense take place, see, like this is a body, dead body. This is a dead body. DB is dead body. This dead body has a knife inside. Now, sir, what are part of corpus delicti? Yes, dead body is a part of corpus delicti. Knife is a part of corpus delicti. Crime scene is also a part of corpus delicti. Crime scene is also a part of corpus delicti. But sir, which is the most important part of corpus delicti? Dead body, knife, and crime scene. Which is the first thing which is required to trace the crime? Anyone? Which is the best thing which we require to trace that crime?
Dead body.
First, dead body. What dead body? Yes. First we require to identify the dead body. अगर देखो डॉक्टर साहब, someone is missing. You have found weapon, you have found crime scene, but if the body is missing, then how can you confirm the crime? It means, sir, dead body identification is the first thing which we require for identification. That's why corpus delicti most important part is identification. Identify the dead body. Most important part to identify this is identification. It means, sir, if you get a question, which is the most important part of corpus delicti, the answer will be identification. Body of offense. Corpus delicti means body of offense. जुर्म का शरीर. पहले ये तो पहचानो कि किसके साथ जुर्म हुआ है. So identification is the most important part of corpus delicti. Now, sir, best method to identify criminal. Best method to identify criminal is fingerprinting. Fingerprint is also known as dactylography. Fingerprint is also known as dactylography. So in crime scene, sometimes you get fingerprint. It is also known as Galton system because it is also known as Galton system. But sir, it was discovered by William Herschel. Discovered by William Herschel. You can remember Herschel or William Herschel. In India, first fingerprint bureau was established in Kolkata. In India, first fingerprint bureau was established in Kolkata. In fetus life, fingerprints start in 12 to 16 weeks and complete in 24 weeks. Complete in 24 weeks. 24 weeks. Sir, dissection of skin. Dissection of skin is up to 0.6 mm from skin for fingerprint. For fingerprint means if this is skin, we can dissect up to 0.6 mm to get fingerprint result. 0.6 mm. Now fingerprint are permanently lost in leprosy. Fingerprint are permanently lost in leprosy, charring, that is burn, and radiation. Leprosy, charring, and radiation, these fingerprints are permanently lost. Now, sir, which is the best finger to get fingerprint? Thumb. Best finger for fingerprint is thumb because thumb has the maximum point. Thumb has the maximum point. Now, sir, how many points should be present? Minimum point for comparison. How many points should be present? Minimum point for comparison. Minimum 10 to 12 points should be present for comparison between two persons. Minimum 10 to 12%. 10 to 12 points should be present for comparison. Best is thumb, worst is little finger. Minimum point for comparison is 10 to 12. Sir, Henry classified fingerprint, and we can remember love, wife, and children. Love for loop, wife for worlds, and for arch, and children for composite. Sir, most common is loop variety. We'll see this is the most common variety, loop. Whirl is like this, Gumaudar. Arch, sir, arch and loop has to be differentiated. I will let you. And 1 to 3% variety is composite. Most common is loop variety. Henry classified fingerprint. Most common is loop variety. Then whirls, then arch, then this. Now, sir, if fingerprint are not visible, if fingerprint are not visible, these are known as latent fingerprint. Latent fingerprint. And latent fingerprint can be visualized. Latent fingerprint can be visualized by silver nitrate, by osmium tetraoxide, by silver nitrate and osmium tetraoxide. osmium tetraoxide. Now, sir, another important MCQ comes. For fingerprint, we use a method. For fingerprint, we use a method. This is known as OFTIR. What is OFTIR? Optical frustrated total internal reflection method. Optical frustrated total internal reflection method. Chalo, first I will show you the picture, then I will ask you some question. See, this picture comes in exam. I think this picture came in recent exam. This picture came in recent exam. Absolutely, 100% I'm ready. This is, sir, this is loop variety. This is whirl variety. This is arch variety. This is arch variety. And I think the question was arch variety. You can see this is loop variety. This is arch. This is arch variety. Actually, sir, arch is the only variety in which there is no delta. Arch is the only variety in which there is no delta. What is delta? 2 or 3 surface of the fingerprint merges with each other. You can see here fingerprint surfaces are merging with each other. That is a delta. In this variety, fingerprint surfaces are merging with each other. This is delta. But if you see in arch, this is no delta. There is no merging of fingerprint. There is no merging of the fingerprint. This is arch. So arch variety is the only variety in which there is no delta. There is no delta. Okay, ये तो मैंने पिछले साल भी जिन बच्चों को पढ़ाया था उन सबको दिखाया था मैंने फिंगरप्रिंट, ये arch, loop and whirl variety. So this is the first method. Now कुछ rapid revision कर लेते हैं. Which is the best finger to take fingerprint? Which is the best finger to take fingerprint? Yes. Thumb. How many minimum points should be similar? Minimum points should be similar. 12. 10 to 12. What are the 2 chemical used to detect fingerprint? 2 chemical name. 2 chemical name. Silver nitride and osmium tetraoxide. Who classified fingerprint? Who classified fingerprint? Henry. Who discovered fingerprint? No, William Herschel discovered fingerprint. Henry classified. William Herschel discovered fingerprint. Fingerprints are completed till what time of the intrauterine life? 24 weeks. Till what depth we dissect the skin for fingerprint? 0.6 mm. In India, first fingerprint bureau established in? Yes, it is in Kolkata. Sir, second method of identification is poroscopy. Your skin contains pores, and this was discovered by Locard. I have already told you this was discovered by Locard, Edmund Locard. This branch is known as poroscopy. Pelletography. Sir, hard pellet. Study of hard pellet is known as pelletography. Study of hard pellet is known as pelletography. Especially we take anterior hard pellet, anterior 1/3 of hard pellet, and it was discovered by Allen. Study of hard pellet, it is known as pelletography. We take anterior 1/3 of hard pellet, and this was discussed by Allen. LF. This is known as palletography. This is known as palletography. Now next is chiloscopy. Next is,
लेकिन सही है भाई, जितना करा रहा है तो लास्ट डे कम से कम थोड़ा जल्दी छोड़ दे तो कुछ पढ़ लेंगे।
सही बात।
क्या?
हाँ चलिए कि लास्ट डे पढ़ लेंगे।
कौन? अरे क्या हो गया जानू?
सर ने सब सुन लिया
हैं? अरे क्या मर गए क्या? क्या ज्ञान बांट रहा था भाई?
सर ऐसे बोल रहा था कि जल्दी छोड़ दो कि कुछ पढ़ लेंगे।
ये तो 7:30 टाइम है ना भाई।
बिल्कुल बिल्कुल सर, कंटिन्यू करो आप।
हाँ मतलब मैं तो जल्दी छोड़ूंगा। मैं देखो, मैं कभी किसी की ज्यादा लंबी नहीं लेता, समझ रहे हो मेरी बात? है ना? 4 घंटे पढ़ाता हूँ, ज्यादा पढ़ाता नहीं हूँ, और बहुत प्यार से पढ़ाता हूँ, याद कर करके पढ़ाता हूँ, पप्पी दे दे के पढ़ाता हूँ, जानू जानू करके पढ़ाता हूँ, करम जलो करके पढ़ाता हूँ, याद करवा भी देता हूँ। है भैया?
सर पूरी ले लो चाहे, पर पास करा दो।
देखो भाई, पास करवाना नहीं करवाना 2 चीजों पे डिपेंड करता है। पहली चीज है पुरुषार्थ। क्या वर्ड बोला मैंने? क्या वर्ड बोला?
पुरुषार्थ।
पुरुषार्थ। पुरुषार्थ का मतलब मर्दानगी से नहीं है, पहली बात तो ये ध्यान रखना। पुरुषार्थ का मतलब होता है मेहनत और कर्म। मेहनत और कर्म को बोलते हैं पुरुषार्थ, ठीक है? दूसरी चीज जो पास कराने के लिए चाहिए होती है, वो होती है आपने मेहनत किस तरीके से की। आपने मेहनत किस तरीके से की। तो दोस्तों, मेहनत करने का तरीका भी मैं आपको बता चुका हूं, और मेहनत तो करवा ही रहा हूं, है? तो मेरी तरफ से तो सही भाई साहब आपका सिलेक्शन तय है, क्योंकि मेरी जिन्होंने फोरेंसिक मेडिसिन क्लास पहले भी ली होगी, उससे बहुत ज्यादा पढ़ाया है मैंने, है ना? तो कोई नहीं। ये प्रभाकरन क्या बोल रहा है? व्हाट्स गोइंग ऑन, कांट अंडरस्टैंड। क्या हुआ प्रभाकरन? चलो एक बार थोड़ा ये कंप्लीट करा देता हूँ, फिर उसके बाद अपन थोड़ी सी बची हुई बातें कर लेते हैं, रिवाइज भी कर लेते हैं। The second is poroscopy, skin contain pore. This was discovered by Lockhart. Palletography, study of hard palate, anterior one thought, discovered by this. Fourth, chiloscopy, study of lip print. Study of lip print is known as chiloscopy. It was discovered by Suzuki. That's a very important MCQ. Suzuki discovered chiloscopy. Suzuki discovered chiloscopy. And Dr. Saab, generally we have 7 type of lip print. 7 type of lip prints. There are aqua prints, and cyanoacrylate. These are 2 things which are used to stain lip print. These are 2 things, aqua print and cyanoacrylate. इससे हम lip print को develop करते हैं. Developer of lip prints are aqua print and cyanoacrylate. Number 5, retina scan. Retina scan is the most precise and reliable biometric method. अरे स्क्रीन नहीं दिख रही क्या?
दिख रही है सर।
इस प्रभाकरण के आज पक्का कुछ ना कुछ गड़बड़ तो है। and is most precise and reliable biometric method that is known as retina scan. Retina scan. सुन ले प्रभाकर, नहीं दिख रहा, सुन ले थोड़ी देर. Number 6, superimposition technique. What is superimposition technique? In superimposition technique, we use skull X-ray, and it is a screening test. We use skull X-ray, and it is a screening test. Superimposition technique. अच्छा, दूसरा प्रभाकरण है. ओके, कोई बात नहीं. It is superimposition technique. It is skull X-ray we are using. It is a screening test. So what we do, we superimpose skull X-ray on negative of the photograph. Negative of the photograph. So if someone died and we are not able to see, or we are not able to identify the person, what we'll do, we'll take photograph of the negative of the missing person and skull X-ray of the dead body, and we'll superimpose. But sir, superimposition technique is not a confirmatory test, it is a screening test. Skull X-ray of a person is superimposed in negative of the photograph. This is known as superimposition technique. Superimposition technique. 7th, tattoo mark. Sir, tattoo mark are also very important identification method. We use many dyes for tattoo mark. Dr. Sir, whatever dye we use for tattoo mark, this dye goes to lymph node level. We use some dye to the tattoo mark. This dye goes to the lymph node level. So we use certain dyes of tattoo mark. There are many dyes of tattoo mark used as indigo dye, malachite green, India ink, vermilion. But sir, this dye goes to the lymph node. So doctor, if you want to detect that dye, you just dissect the skin till lymph node level. And tattoo mark are useful for live person, dead person, as well as decomposed person. It means that it is useful for identification of live, dead, and decomposition. If all three options are given, best answer will be decomposed. There was a very famous case which was identified by tattoo mark, that was Sydney shark arm case. A very famous case which was identified by tattoo mark, that was Sydney shark arm case. Sydney shark arm case. How to make tattoo mark visible? We use infrared rays. We use infrared rays. But sir, infrared is used for old tattoo mark. For old tattoo mark. For faded tattoo mark, we use ultraviolet rays. Infrared rays is used for old tattoo mark. For faded tattoo mark, we use ultraviolet rays. Ultraviolet rays. This question comes in exam. Okay, now sir, another important identification method is anthropometry. Sir, anthropometry is also known as Bertillon system. Anthropometry is also known as Bertillon system. Another name is portrait parlay. Another name is portrait parlay. Portrait parlay. Now, sir, how do we identify person? By anthropometry. It is based on physical measurement of a person. Height, stature, physical measurement of the person, body marks of a person, and descriptive data of a person. We are using physical measurement of it, like height, length, stature, marks present on the body, scar mark, mole, tattoo, and descriptive data. Sir, this branch is, look, sir, a simple example. You found a finger, you found a cut finger somewhere. By this finger, you can identify sex of a person, DNA of a person, stature of a person, or many other things. So this branch is known as anthropometry. It means that only by body part, body marks, by physical measurement, by descriptive data, we can identify the person. This branch is known as anthropometry. This is also known as portrait parlay or Bertillon system. This is also known as portrait parlay and Bertillon system. Now write down some questions, sir. What is the technique in which we use? What is the technique in which we use skull X-ray? Skull X-ray. Skull X-ray. Superimposition technique. Very good. The answer is superimposition technique. For faded tattoo mark, which technique is used? Faded tattoo mark. Yes. Ultraviolet rays. Yes, answer is ultraviolet rays. For old tattoo mark, sorry, faded tattoo mark, ultraviolet. For old tattoo mark, which technique is used? For old tattoo mark, which technique is used? Yes. It is absolutely right. It is infrared rays. Tattoo mark is used to identify live, dead, decomposed. What will be the best answer? Live, dead, decomposed. What will be the best answer? Best answer would be, yes, absolutely right, friends. Best answer would be decomposed. Vermilion, malachite green, India ink are the dye used for making what? Dye used for making what? Tattoo mark. Dye used for making tattoo mark. Tattoo mark. Sydney shark arm case was a very important case of which was detected by. Sydney shark arm case was a very famous case detected by using what? Tattoo mark. If tattoo mark is present on your body, skin should be dissected up to what level to see that dye? Skin should be dissected up to what level to see that dye? Yes, it is lymph node level. Yes, it is lymph node level. By physical measurement, by descriptive data, by body marks, we identify the person. What is the name of this method? What is the name of this method? So this branch is anthropometry. This branch is anthropometry. This particular branch is known as anthropometry. Very, very important. Another important MCQ, that is another important MCQ. Cyanoacrylate and aqua print are used to see what? Lip prints. Lip print is the best answer. Allen discovered which method? Chiloscopy or palatography? Allen discovered which method? Chiloscopy or palatography? Yes, answer is palatography. Answer is palatography. Palatography. Suzuki discovered which method? Suzuki. Yes, Suzuki discovered oscilloscopy. Very good. Suzuki discovered oscilloscopy. Which is the most precise and reliable method of biometrics? Biometrics. Retina scan. And which is the best method for criminal identification? Criminal identification. Fingerprint. Fingerprint. Okay. Portrait parlay is another name of. Portrait parlay is another name used for. Yes, it is anthropometry. Yes, it is anthropometry. So anyway, sir, this branch is known as anthropometry. So Dr. Sir, this is all about for today's class. So my target would be to finish the class. My target will be to finish the class up to in 2 days. Okay.